Get started on the subcommittee work session for Senate Bill 44. And Lindsay. And this is the one that makes some changes for mainly the scope of practice for the MLDACs. And I know Representative Grota has an amendment if you want to just mention what's in it.
Yes, I'm sorry, this is Senate Bill 44.
Yep.
So in Senate Bill 44, originally, criminal justice degrees were accepted for this, well, a specific criminal justice degree that was being offered by SNU was in the bill. However, they're no longer offering that class or that series of courses, so that is eliminated from the bills on page 2. However, they are going to, in rulemaking, allow criminal justice degrees should these specific courses be included in their course of study. So that's why the amendment to Senate Bill 44 was made, and that's how the amendment is written.
Okay. And Director Courtney, if you could come up, I just have a question. I just want to verify that, well, you can introduce yourself.
Certainly. Lindsay Courtney, Executive Director, OPLC.
So my question is, since there is a list of degrees that meet the requirement, is there any problem adding something else later in rulemaking, or is that?
I think as long as it is consistent with the statutory definition, then that would be okay. I do know that they currently already permit what was this new program under their existing statutory framework, so I don't think a statutory change would be necessary.
Right, but I mean, this amendment would remove the criminal justice one, and I'm wondering if it's actually removed from statute, if you'd be able to allow it under rulemaking. That's my question.
Oh, so my understanding was that Senate Bill 44, as introduced, added the criminal justice degree as a possible pathway to licensure. It doesn't presently exist in statute. So by amending it to remove that, I think we would just be left with the status quo.
Okay, but the question is, if that criminal justice program were offered again, for it to be accepted, could that be done in rulemaking, or would it require a statutory change?
I think it could be done under rulemaking, as the board is presently already allowing that, provided it meets the 60 hours master's degree requirement.
Okay, thank you. Any other comment on this? Questions? Okay. In that case, if somebody has a motion.
Mr. Chair, I'll move the amendment.
Okay, and I've got it in here somewhere, but what's the amendment number?
1453H.
1453H. Do we have a second? Jackie?
Oh, I'll second.
Okay. Okay, so we're voting on adopting Amendment 1453H for Senate Bill 44. I'll just go around in order. Representative Hebert.
Yes.
Goley. Yes. Bailey.
Yes.
Rhoda.
Yes.
And the chair votes yes. 1, 2, 3, 4, 5. Okay. So we adopted the amendment. And we have another motion on.
Yes, I'll move on to pass as amended.
Okay. And a second.
Second.
Okay. Any discussion? Take it no. Okay. Representative Hebert.
Yes.
Goley. Yes. Bailey.
Yes.
Rhoda.
Yes.
And the chair votes yes. So 5-0. Recommendation is OTPA. That's easy, I was hoping. And then We'll go on to Senate Bill 149. Find it here. All right, so this is the relevant nurse agencies that put some requirements on what really sorts of things they can't do. And at least from my standpoint, the biggest, well, there's two big ones. One is sort of bait and switch, where they offer somebody a certain price, and at the last minute, they say, oh, somebody else is offering more, so they raise the price. And that, I mean, I think I'd rather see it dealt with by looking at the contract to see if it's in there, and if it's not valid under the contract, to get the AG to handle it. But I guess that's not working. So, and the other one is the prohibition of placing a nurse who is not, qualified to actually practice in the state due to licensing problems or suspension. So there's an amendment to that. Would like to speak
Yes,
to it?
this amendment, and I believe I gave you all the copies of the amendment, so I don't have the amendment
It's right-
number.
It's right there on the table behind you.
Okay, just a moment. Sorry.
They're both there. That's okay. It should be 1463H, is that,
Yes.
okay, cool. So if you could just describe what's in the amendment.
Yes. So in the amendment, there was a hanging prepositional clause for such reason, and then it didn't state a reason. So we eliminated that clause, and I believe it's on page 2. I don't have the
Yeah, I've got it here.
sentence.
The original bill, it's on page 2, lines 8 and 9, at the end of line 8.
Okay.
And, nurse agencies shall not commit the services of a single nurse or licensed nursing assistant to more than one healthcare facility for the same time period or shift, and cancel a commitment to a facility or compel that facility to bid again for services already promised it for such reason. But as you said, there's nowhere up above does it say reason, so that makes no sense. So that's,
Right, and I believe that's the only change to the amendment,
Yeah.
to the bill, that this amendment, that's the amendment to the to the bill.
so any questions or comments on the amendment or the bill itself, actually? Okay, Glenn, Representative Bailey?
Yes, thank you. I have a problem on page 2, Roman numeral 3, where you can't charge extra under extraordinary circumstances.
Okay,
Don't care for that. I believe that's a violation of the law of supply and demand, which is a higher law than this.
yeah, I can see that, but there's nothing in here that sets a limit on, what they could bid for providing a nurse in any circumstance. So there is, I understand that. I mean, this may provide a little help. I don't think this is a significant solution to the problem. I think the real solution is to get more nurses working, which, I mean, we've done some stuff for, and there's,
Wouldn't that be achieved by paying a higher rate?
well, this
Even-
doesn't prevent them from
Yeah.
charging a higher rate. It's just bumping it up for certain circumstances. And,
Mr. Chair, if I may.
yes.
I think we heard in testimony what was happening is after contracts were made, there were fees added on above and beyond due to instances such as COVID. Once a contract was made, they were tacking on an extra $50 fee or $60 fee. And if someone out there can
Yeah.
clarify whether I'm right or wrong on that, I think that's what I heard in testimony. And this is what that's trying to prevent once the contract's done, to say, well, we're in an emergency. And by the way, the contract you signed, we're tacking on another.
Right.
such and such.
I see that as similar to the problem of they agree to provide a nurse at some price, and they say, oh, somebody's willing to pay more, almost literally at the last minute, and bumping it up, which I suppose that, you know, depending on the contracts written, that may or may not be a violation of contract, but I think we heard, and maybe somebody here can speak to it, that they had contracts that didn't mention increases due to the infectious disease situation, and then they added the requirement at the last minute. I don't know if anybody, you want to come up and just introduce yourself and speak to that?
Good morning, Mr. Chairman, members of the committee, Paula Minahan from the Hospital Association. I believe that is accurate. I recall that in the testimony as well from some of the individuals that actually signed these contracts. So I think that's what we're trying to address.
Right. I mean, I don't have proof of that, but we certainly heard testimony that that was going on. And that's what this is meant to affect. I mean, if they, but there's no limit on
Right.
the charge they can charge for providing a nurse. So. Which wouldn't make sense anyway. I mean, because they're going to have to pay what they're going to have to pay to get somebody. Any other questions or discussions? All right. Would someone like to make a motion?
I'll move the amendment 1463H.
Okay, 14. And a second?
I'll second.
Okay.
No.
All right, any discussion on this?
I do also want to make a, Mrs. Minahan reminded me that we did change the RSA reference in
Ah,
the,
that's right.
excuse me for forgetting that,
Yeah, it was,
which makes it a separate registration.
yeah,
That
dir-
was why a separate RSA reference was, this is one that is not being currently used. So we're going to put it there.
right. And I think it was under 326B, which was the nursing one. And I mean, they weren't, I know, they weren't going to, I mean, the nursing board wasn't going to have anything to do with this anyway. It's just the office. So it didn't make sense for it to be there. Okay, thank you. All right. Any other discussion? No? Okay, so we're going to vote on whether or not to adopt Amendment 1463H to Senate Bill 149. Representative Abear,
Yes.
Goley,
Yes.
Bailey,
No.
and Groda.
Yes.
And the chair votes yes, so that's 4-1. And do we have another motion?
I'll have to pass as amended.
Okay. Any discussion? Probably not. Okay. And a second? Yep, thank you.
I second.
Okay. And we're voting on ought to pass with amendment 1463H for Senate Bill 149. Representative Abear,
Yes.
Goley,
Yes.
Bailey.
Bailey.
No.
Brain fart. Yeah, Bailey. No. Okay. And Groda.
Yes.
And the chair votes yes. So again, that's 4-1. And so I'm going to close the subcommittee work session for these two bills. And we've got about 40 minutes, I guess, and I'll get out of this chair. Ah.
Good morning, everyone. It is 10 o'clock, and I would like to open the public hearing on SB 74 and welcome Grant Boss for Senator Carson.
Good morning. Thank you, Mr. Chairman, members of the committee. My name is Grant Bossie from the New Hampshire Senate, introducing Senate Bill 74 on behalf of Senator Sharon Carson, the bill's prime sponsor. This bill is a request of the Department of Administrative Services. It makes several small changes to clean up language in the statutes to avoid confusion. One substantive change in Section 16 authorizes the Director of Personnel to review and approve salary adjustments for employees who are hired at a higher step than longstanding employees in order to help with recruitment, as you know, a longstanding problem that DAS is trying to address on several fronts. SB 74 received unanimous support from the Senate ED&A and Finance committees, as well as the full Senate. I would defer any questions to Commissioner Arlinghouse and his staff. Senator Carson, thanks you for your consideration and support of Senate Bill 74. Thank you.
Thank you. Will you take any questions?
If you have questions for Senator Carson, I can get you an answer.
Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair would like to call Representative Carol McGuire, who will be presenting an amendment. 1502H.
Right. Good morning. I'm Carol McGuire representing Merrimack 27, which is Allenstown, Dunbarton, Epsom, and Hooksett. And this amendment to 74 is a request of the Department of Administrative Services also. And it is looks like a lot of little cleanup and language adjustment. You'll have to ask them about the details, but none of it looks like it's making any major changes to policy. And if you have technical questions, I will defer to the department. If you have other questions, I'll be glad to answer them.
Yes, Representative Schmidt.
Thank you very much, Mr. Chairman. And good morning, Representative McGuire. I'm wondering whether the proposed amendment has been discussed with any members of the Senate as well.
It has been discussed with the prime sponsor, Senator Carson, who doesn't object to it, but didn't think she should bring an amendment to the House.
I didn't hear the last part.
She didn't think she should bring an amendment to
Well,
the House, but
yeah.
she has no objections to it.
Thank you.
Any other questions? Seeing none, thank you. Charlie Arlinghouse from Department of Administrative Services.
So I filled out the card, but I'm not going to talk.
Okay.
I'm Charlie Arlinghouse, and you'll be happy to know I'm not going to talk. I'm the Commissioner of Administrative Services, but with me are the two people who know what's going on.
Good morning. I'm Cassie Keene. I'm the Deputy Commissioner of DAS, and let's see whether Charlie talks.
Lori Rudis, the Director for the Division of Personnel. Thank you.
Thank you to Representative McGuire for introducing our amendment. This bill, we requested Senator Carson to sponsor in the Senate, and we had a hearing with them, and the question was, were these amendments discussed in the Senate? And I'll explain that. Lori Rudis is our Director of Personnel, and she was hired back in 2018. And we actually, in the recruitment process, talked about the need to update our state personnel system. Charlie and I were working together and working with the agencies, and there was a lot of frustration about really an archaic personnel system that had been established about 50 years ago, and that wasn't nimble and didn't allow managers to respond to whatever their business needs were. And we knew we had to modernize the system and make it more flexible and have it work for agencies and managers.
You're good. Continue.
Okay, sorry. Much of this bill is updating of language to support the changes to the personnel system that the Division of Personnel is doing. What are they doing? when Lori came in, we had a personnel system with more than 2,000 working titles for kinds of jobs across state government. We are reducing the numbers of titles and taking our jobs in the state personnel system and mapping them back to national standards for standard occupational codes, and having our system therefore be more flexible to what is this position, what's the nature of it, and what level should it be. So when we tie to national standards, there are words that we have used in the past to describe processes, say for changing positions, that no longer will apply. One of those words that you'll see that we're asking to be removed from the law is reallocation. When we have a position, and I'll make it a stark contrast. When we have a position, let's say it's a secretary, and we say, I don't need a secretary, I need a manager. We do a process called reclassification. That is going to be the new terminology, and that is an example of the kind of vocabulary changes that you'll see in the bill. Why didn't we catch this stuff earlier? We're doing a lot of work on many fronts all at the same time. So between the Senate hearing and today, we've continued to comb through the law. And over here on my right is Matt Mavergeorge. Matt is an attorney. He worked in the AG's office for more than a dozen years. And he works with Lori to comb through the laws, the administrative rules, to make sure that we're looking forward with those and proposing changes that support the modernization of the system. So I'm happy to walk through the bill and the changes if you'd like, or whatever you would please.
I don't think we need to go probably into quite that detail on it. Are you willing to take questions?
Sure.
Representative Schmidt?
Thank you, Mr. Chairman, and good morning to all of you from DAS. I'm asking this question in my capacity as a member of the JCEC, which Commissioner Arlinghouse is one of the primary operators in, and also on our committee is the new chair of the JCEC, Representative Lekes. And so I'm wondering, the terminology changes that you're talking about, are they also in the neighborhood of, or in the category of classification changes? Because that's what JCEC is tasked with. I'm wondering if you could speak to that issue.
Sure. The JCEC, the Joint Committee on Employee Classification, is is functionally the governing body of the unclassified system. Unclassified employees are typically appointed employees. Three of us all happen to be unclassified, and they tend to be commissioners and the like. This is all about the classified system, which is the 11,000 regular, normal, typical state employees, as opposed to the 346 or 48 or whatever it is now, unclassified employees. So none of it is relevant in that system, and the word structures are different. The big difference is that the changes that were made 73 years ago, if we're counting, to the classified system.
Back in my youth.
In your youth, yes. In 1950, they govern everybody, and there's a lot of technical language. I mean, a lot of what's going on, increases in salary becomes changes in compensation and that kind of thing. Year after year, people just don't bother. We do what we do, and the law says something close to what we do, and we just let it go, because it doesn't stop us from doing it. But this is about making, the law uses terms that we actually use. And so you don't read the statute and go, well, what they mean is, like, it says reallocation, but it's just everything that we call a reclassification. Oh, okay. And this makes all those kind of changes. But it doesn't affect the JCEC process or language at all.
Thank you.
Yes, Representative Lekes.
Thank you. I'm taking a look at the amendment and trying to see what it changes. So the amendment that affects Section 6, as far as I've gotten, As far as I can tell, let me know if I'm missing something. All it does is remove 3 words at the end or the board. The rest of it, just looking through it, it seems identical. So does it do anything else?
Yes, I mean, frankly, if you think of the amendment as our lawyer having looked at the draft that came out and looked at, oh, wait, that word's missing. And that, because in anytime you draft something, occasionally, because things are added and subtracted, somebody goes, oh, wait, we forgot to, no, people left out the and, or the word assigning, for example, is added. So it's very legalistic
I guess
corrections.
follow up, if I may.
Follow up, yeah.
Yeah, my specific question is on that, the part that affects section 6. Is it changing anything other than the 3 words at the end, removing them of section 6?
Not in section 6, no.
Okay, thank you.
Any other questions from the committee? Representative Billy?
Thank you, Mr. Chair. I just have a question as to why, when we are looking to provide these bonuses or doing whatever we're doing, why we are no longer involving, if we're spending money, involving the fiscal committee.
I think that what you're might be referencing is it in the general bill where you see the redaction of the recruitment and retention bonuses?
Yes, on page
Okay.
1, starting at line 12.
I can explain that. Last session, we asked for authority to, and I believe we appeared before this committee to empower the Division of Personnel to establish a program to award recruitment and retention bonuses. And that bill got amended in the Senate, and it required, those changes in the Senate required approval of the fiscal committee of policies and payment amounts. And the Senate put in a sunset provision into that, their amendment of that bill. And since that time, we did establish a recruitment bonus program and a retention bonus program funded by ARPA funds, approved by fiscal, policies approved by fiscal, but that law sunsets. And so, pardon? June 30th at the end of this biennium. So that's why you see that redaction in the bill.
Okay. Further question?
Follow up.
When I go to, and let me find it, I had it here in front of me a minute ago. We'll go to page 6, starting on line 13, the salary adjustment.
The bill itself, not the amendment.
Yes. Page 6. Sorry.
Line 14.
Hold on.
The Director of Personnel has approved beginning compensation at a step higher than the minimum step. And then it goes on to say that they may increase for the salary for others in the similar positions if it affects recruitment and retention. Now, we're here and heard a bill not too long ago with nursing staffing agencies and the problem they were having when they were recruiting and hiring nurses from travel agencies at higher pay, and there was a little bit of animosity of people making more. And I guess my question is, why wouldn't you, if you're going to hire someone at a higher pay grade doing the same work, then automatically move the rest of those folks up doing the same work if you want to retain them?
It's actually what the bill is trying to address. Is there situations where that happens, and if you think about it, in a, I'm going to use an example. In a division, you hire somebody, for one particular job, and they have the similar title, and it happens to be a labor grade, let's just say 25. And they're a step 4. Somebody else comes in and based on where they were coming from, their level of experience, you hire them occasionally at maybe a step 8. Once in a while that happens as a one-off. You know, somebody's getting hired right out of college into a job. Somebody else is getting hired who's been working for 20 years, and they come in because of where their life experience. And in a one-off case, that can happen a lot, and everybody doesn't necessarily get adjusted. The situation where it's mostly problematic is when the job market changes, and I'm going to use for example our grounds crew, right? The job market changes, and there's no chance we can hire anybody at step one. There's just, you know, you can do much better than that at Dunkin' Donuts. And so what happens is you're hiring people at that point at step 5. Everybody who comes in gets hired at step 5. You've got a handful of people who were at step 3 and aren't, in the way the normal system works, necessarily adjusted. The idea is to get some authority to do that, to address the issue you're talking about. Why would we say to the guy who's at step 3, look, it's not that you don't have the experience, it's not that you know he's been doing this for 40 years and you're new. He just happened to get hired at a different time, and somebody could make that adjustment, and this grants that authority. Today, there's no authority to do that. They would have to, frankly, the quote unquote workaround is they would quit, and then you would rehire them, and that's a little cheesy. And so this is to give the state an opportunity to do something that's not cheesy, if that makes sense.
Any other questions? Seeing none, thank you very much for your testimony. And you didn't speak admirably.
Thank you.
That is the last pink card I have on SB 74. Was there anybody else in the room who wanted to speak on this bill? Seeing none, I will close the public hearing on SB 74, and we will reconvene in 25 minutes. Oh, sure. I'll let you do that.
Since we do have a quorum, and I'd like to mention that today is Wednesday, obviously, and the deadline for committee reports to be in the calendar for the session next week is today. So we're going to, this afternoon in our executive session, deal first with any bill that has a committee report already written. So I will rely on you to whip up a few over lunch. And we'll try to get as many as possible into the calendar, just to make it easier on all of us. And in that case, I suggest we have an executive session on this bill, Senate Bill 74. And I will move ought to pass with amendment and bring out Amendment 1502H. There's a second. Thank you, Representative Gould. I don't want to say anything. You wish to speak to your motion? Or your second? Okay. Representative Hebert. Oh,
I have a question, Madam Chair, and I'm not sure who it goes to, but I guess it's just a discussion item. So one thing that really goes against my spirit is when we have funds that we receive through grants and then it sunsets. That's what I just heard, and maybe I didn't hear that correctly, that it's a fiscal note, there's no money on it, and then those funds expire, and then what happens? Is that tax-paying money that has to now go to that? I'm just unsure. Thank you.
Representative Blackus.
I'll give my understanding of this and then correct me if I'm wrong, because I'm not certain I'm right. And that is, I think the ARPA funds are being used, as I understand it, for the hiring bonuses to get more people in, but that program sunsets, and I wasn't sure whether it was June 30th this year, said at the end of the biennium, which would be next year, if that's correct. But in any case, it sunsets as well, and then the grant money presumably sunsets. And so my understanding is we're not setting ourselves up for an ongoing expense when the grant money goes away. Is that your understanding?
My understanding is that the bonuses are paid when the people are hired, and if we do it right, there will not be any money left over to turn back to the federal government. Is that correct, Commissioner?
Yes, although it's possible that there will be money turned over to the federal government. But but there's no obligation to the state. There's not an ongoing obligation of any sort.
So,
Programs
Thank
are
you.
all expiring.
and
So
when is
it's
it
a-
actually expiring?
It's a June 30th
Of this year?
this year.
Okay, thank you.
Thank you. Thank you for the information. Representative Aber, does that answer your question?
Yes.
Okay, good. Any other questions or comments? Issues?
I have a question, Madam
Yes,
Chair.
Representative.
So your amendment, as Representative Leckes was at least alluding to, does basically make, there are a number of changes that are made in Senate Bill 74, and your amendment picks all those changes up and
natural
repeats them and incorporates them and so forth. And so the only question I have is, has this been carefully vetted with regard to just the secretarial aspect, if you will? Because otherwise there's a lot of, you keep looking this way and you're shifting back and forth. Net effect is nothing, to some degree different than is already in the bill. But if it hasn't been carefully vetted, then it could be that we're going to have to pick it all up again in the Senate because they haven't done this stuff.
Thank you. I will not say that I have carefully vetted every word. The Department of Personnel and Ms. Keene have.
Good.
And if you find,
No,
and if there
at
is an
first
issue-
glance, I was seeing the same things that Representative Leckes pointed out. It's the same thing, and there are very few additional changes in your amendment. But the bottom line is, those are there, and if they've carefully vetted it, it's on you.
And since they're the ones that are going to have to follow these laws, I'm sure they take that part very seriously. All right, and Representative Schuett and then Aber.
Thank you, Madam Chair. I would just make the comment that, as the commissioner stated, if the current steps for certain positions are not adequate to attract employees or retain employees, that perhaps you should consider increasing steps for certain positions going forward.
Okay, thank you. I'm sure they will take that to heart and to budget. Representative Aber.
This is more of a follow-on question. So if this ends in June, this bill says it would pass after 60 days. Would that, then why would we be passing it? I didn't understand.
No. The grants, the ARPA grants end in 60 days, which means that they would not be able to pay recruitment bonuses from those grants after the end of June, but you are allowed to do so under current law, correct? I mean, clearly they have been paying recruitment bonuses.
The bonus part, so the bill's not in, it's only a little tiny piece of the bill that it's the ARPA funded retention and recruitment things. And those are all going away, but the rest of the bill is not. And that's the rest of the bill takes effect in 60 days. The ARPA thing just goes away.
Okay, Representative Leckes.
Yeah, if I understand, we passed a bill last time letting them do this, to have the ARPA thing, and that the change related to the ARPA thing, as I understand it, is if you look on page 1, from 13 to page 2:8, it's just deleting that stuff. So the money's going away and the authority to do it is going away.
Mm-hmm. Okay. Representative Schuett.
Thank you, Madam Chair. Thank you, Commissioner. Is there a specific time limit that the ARPA funds have to be used by, and have they all been accounted for?
I think the bonus programs are essentially done. Does anyone have a tail? Yeah. No, so they were one-time events and they've all expired at this point.
Okay,
Follow up.
follow up.
And were we able to use all of those funding according to the rules?
The funding that was allocated by fiscal from the ARPA funds is, I don't want to say all, because all implies 100%, most. There's a budget. We kind of knew how many positions were covered by the retention incentives, et cetera. And we had a decent estimate of how many people would get hired. And it worked out. So we were pretty close, but there's some left over that goes back to ARPA, and then don't ask me what they do, because I haven't the foggiest.
Spend it foolishly, no doubt. Representative Bailey?
Thank you, Madam Chair. I guess it's that same section that's being deleted. The Roman numeral 6, developing a program for the recruitment, selection, placement, and retention of specified applicants in the state service, and then everything after it is deleted. So I'm kind of wondering, why is that even there then? Unless you need this placeholder, or all of the stuff.
They should have a program for recruitment and retention, but they won't have the specific ARPA-funded bonus program. But
I
they
see.
should have a plan for how they're going to recruit
I just
people.
wondered if we needed another line of strikeouts, but no, there needs to be something
I
there.
would certainly
Yeah.
hope they have a program for recruitment.
Thank you.
Everybody does. I mean, if you run an agency, a hot dog stand, or anything, you have a plan for recruitment and retention. And, we have a unit that helps with recruitment. It's just that the statutory authority here is not necessary for that operational thing.
Thank you.
Okay. Other questions? Comments? All right. In that case, the motion is to adopt. Yes. Who was that? All right. So Representative Schuett, sorry. Did you
No,
have something?
No, I think I moved my microphone. Excuse me.
That's okay. Just startled me.
The deputy commissioner seems to be on the verge of speaking almost without permission.
We can't have that. Ms. Keene, do you have any
But
comment?
she clearly wants to say something, and I
All I was going to say, when back to the recruitment and retention program, is the strikeouts about the recruitment and retention program reflect Senate Bill 226 from last session that authorized the program that, again, in the law, sunsetted. So the strikeouts reflect the law that sunsetted, and the language that remains, that was the question, is the language that has been in the statute forever.
Okay, thank you. Any other comments? All right, then the motion is to adopt Amendment 1502H to Senate Bill 74, and the clerk can call the roll.
Representative Simon,
Yes.
Representative Lekis,
Yes.
Representative Bailey,
Yes.
Representative Santonastazo. Oh, he's absent, excuse me. Representative True,
Yay.
Representative Dolan,
Yes.
Representative Abar,
Yes.
Representative Gerhard.
Yes.
The clerk votes yes. Representative Schmidt,
yes.
Representative Goley,
Yes.
Representative Schuett,
Yes.
Representative Horrigan,
Yes.
Representative Grassi,
Yes.
Representative Davis,
Yes.
Representative Fitzpatrick,
Yes.
Representative Gould,
Yes.
Representative Smith,
Yes.
and the chair.
Yes.
18-0. The amendment passes.
All right, the amendment is adopted, and I move ought to pass with amendment on Senate Bill 74.
I'll second.
Thank you. Unless All right.
Who was
I
the
don't have
second?
anything to say. Simon, do you have a comment?
No. I was the second.
And you moved, you made the
What's that?
motion. You made the first
I
motion.
made the motion, yes.
Okay, yes, thank you.
Any questions, comments, or discussion? All right. I think we covered it.
Representative Simon,
Yes.
Representative Lekis,
Yes.
Representative Bailey,
Yes.
Representative True,
Yay.
Representative Dolan,
Yes.
Representative Abar,
Yes.
Representative Gerhart.
Yes.
The clerk votes yes. Representative Schmidt,
Yes.
Representative Goley,
Yes.
Representative Schuett,
Yes.
Representative Horrigan,
Yes.
Representative Grassi,
Yes.
Representative Davis,
Yes.
Representative Fitzpatrick,
Yes.
Representative Gould,
Yes.
Representative Smith,
Yes.
and the chair.
Yes.
18-0. The OTP passes.
All right, thank you. Is any objection to consent? Seeing
I don't think
none.
it spends any money, so I think we're okay.
Thank you, Representative Schmidt, for that vote of confidence. Okay, I would like to welcome Representative Grassi, who will be on this committee permanently in place of Representative Wilhelm. So I hope we'll have his attendance more often. And we have 15 minutes breaks before the next bill, which will give me time to write my committee report.
So I went to Senate Bill on House Bill 347. The bill that we do with laws. Make this pass out minutes to public.
Oh, yeah.
Board meetings. During the sponsor.
Yeah.
And thinking it was going to be a slam dunk, right? I mean, passed the House on a roll call here, 387 to nothing.
Right.
Attorney Osterhaus was there from the PLC. Gary spoke, I spoke, and said, OPLC has no position on this bill, and then proceeded to present 7 pages of testimony with 5 objections to the bill, mainly. And Sharon Carson blasted the shit.
She did?
Yes, because, well, that whole bill was based on that study that the commission did that she served on.
Yeah.
If you recall, when we had the hearing, Lindsay Courtney was here, she felt they can comply with the mandates to have materials passed out. You and I subbed on Tony's subcommittee. She was there.
Yes.
We talked about this is how we.
None of the, there's no objection.
No objections.
No.
And now suddenly they come in at the last minute with 5 objections.
What did did they pass it?
I don't know.
That's what Sharon.
Sharon, yeah, and I talked to Tony. I mean, that was just so disingenuous to do that. Why would he do that? I said to Tony, I don't know if it's suddenly attorneys looking at this thing and saying, oh my God, we can't do this, or, you know, what the hell it is. But Sharon said to him, you know, don't you people talk to each other? Director Courtney, she said, I know Director Courtney was heavily involved in this process. And now you're coming in with this at the last minute? I said, what the hell's going on? Just utterly ridiculous. You know?
That's a pain in the neck.
Unbelievable.
Let me see.
It's on the 5 there, Judge, what's her name? Judge Janine. Might be next because she was. January 6th thing. I guess Rupert Murdoch too. She's closet down. Didn't he wants to move the whole network? Back in CNN, inspiring. That's Seinfeld. I saw a clip yesterday. I had never seen it before. He said, I think he may have been a little screwed. He told one of his guests, became my female guest, said to a nice rat. You can't say things. Good, how you doing? Good.
So good question for that.
Doing all right. Can I introduce to you?
Yeah.
You may. Nice. Very well. How are things? Things are well.
Yeah.
So,
No.
good.
Okay. Yeah.
Keep on moving. Yeah. What are you guys on this one? So we are in support of this.
Yeah, it's there.
They're already, they're 100% generous funding already.
I mean, once, given this state, the problem is don't.
I get it.
But the problem is, I don't know.
It's not a mandate, it just gives them the option. They can basically, it's a better plan, you know, however priced, it's the same. Yeah, you got more. We can have 37,000 people out here. Yeah. So
Look at even the.
it's an opportunity for. Yeah. Yeah, the only question.
I think if we were paying. So it's 6%, it's regular.
Yeah, no, it's, from what we can tell, it's, if it's not saving the state money, it's a. And they should have the numbers. Versus contracting out for the broker for
Well, here's the deal.
the broker.
Here's the,
What's that? The broker will be south.
here's the,
Exactly.
we're going back. Even with full honesty about this. Honestly, needs to put came back. Oh, we're not gonna get that. Except with the current situation, obviously, the economy. The honest with you is to say, sorry, we're not paying. We can't. Right? And so, I mean, I can't. Any assets trying to come to the US, they're going to do with Russia. Just take it. That's what happened with Russia. Oh, no, I'm not saying this is going to be good. Once it's another great as well, the people, the other countries are not going to be. And then either, I think it's good going. Either this thing.
Good. I see you're on 105.
Yes.
How do we know who belongs to who?
Maybe we get some more.
Well, it strikes the personally identifiable information regarding the mother, father, infant, prior to submission. Her name,
Well, the
maiden
problem
name,
is that.
like, how do we know what child belongs to who?
The Senate, right, there is, the Senate effed up this big time. I talked to Carol, so the Secretary of State came to Carol and said, the way this is written, if you pass it, we can't do birth certificate. So Carol has a proposed amendment, which I've got on my phone, I started taking a look at. Why the Senate? I don't know who's going to introduce this. I'm hoping Senator Roosevelt will be here, but I don't know if she will. And explain what the heck the Senate was thinking. Because they broke the bill.
Right.
And I don't know why.
Yeah.
I went and I found, they have clerks that, paid staff to take notes. And that's available. And I went and I read those, and it didn't really explain. There was some discussion, but nothing that explained why somebody wrote this amendment. The Senate. And I was looking at this last night and this morning. Yeah, I've got the bill that's introduced. As amended by the Senate. The Senate amendment. But you only have to print those bills. But I was on that study group that was created by Philip before with Senator Rosenwald and Jess Edwards and Brett Rucker. And Rosenwald, great on this topic. She is very supportive of privacy. And so 105 came out of that. But the original bill was just like, it's introduced, it's it's less than a page, and it doesn't cause those problems. I mean, the main thing it does is the original bill. It's just, the criminal penalties don't apply. That shall apply only the information on the mother's worksheet that's used for the birth certificate. Shall not apply to the father's, mother's, female partner's information or the mother's statistical information. So no criminal penalties. I mean, you don't have to. You don't have to declare who spouse and father. That's not a penalties required now. And it shall not apply, the penalties shall not apply to anyone who refuses consent for disclosure of this personal information of every newborn or any other person identified with health information, so live birth. So that's not what you need to do. And the mother shall be given the opportunity to withhold consent to the release of their identifiable health information from their newborn's medical records. And then the requirement that the worksheet that's filled out is redone, and the deal there is to clearly make it very clear what parts have to be provided and the penalty provided going by false information, and what stuff's optional, which you can opt in or opt out. And that was the original bill. And the Senate said, the senator went and listed all the stuff, and it doesn't, their amendment doesn't work.
Good. Okay. Well, I'm glad that you think it doesn't work, because I'm looking at it going.
They trashed the bill as co-sponsor.
Right.
Stupid.
That's frustrating. Okay. Well, I'm happy to know that.
And so
that you're with me.
I'm waiting to see who introduces it and what they say about the bill as amended.
It'll be up to the commission.
And I'm sure Carol will. I wasn't planning on getting out.
Killing it
Unless
having
somebody
it
else
survive.
shows up, I guess I'll introduce it. But I will introduce it and not be complimentary to its current state. Please, this fix this frickin' bill that I like, except the Senate trash.
Okay.
So that's the deal. Yeah, I mean, the Secretary of State noticed that I won't be able to burst it.
Right.
It's interesting, you saw the picture of the
That's
youth.
probably.
It's a minor problem.
I'm not big on, that could cause.
It could cause. Yeah.
If nothing else, it's like, the kid will never be able to get a passport.
Right.
Yeah. Or a real ID. Or much other stuff.
They keep shining.
how do you do
folks that I
probate?
sent you that also, the other.
There's no evidence.
They've
of
got-
you-
they've kind of dissolved.
And
They were in the
when-
Midwest.
Yeah. I'm wondering, did they send something, send something asking us to do some general thing and then they couldn't do that? And they just accepted it? I'm trying to imagine how this happened.
How this came about.
Right. And
Yeah.
It's gotta be, somebody,
My friend,
nobody
her
in the
name is
Senate.
now lives in Alaska.
Yeah.
Unless
He
I
wasn't
missed
much
it.
help.
Maybe we'll hear.
He told me a little bit. I thought he was from the East Coast.
I was
Mid-Atlantic.
unamused.
No,
Okay.
Midwest.
Oops.
The Senate, the Senate, I'm trying to be polite. The Senate broke the bill. Really broke the bill. Yeah. I mean, your bill is introduced, was very simple, straightforward, and didn't cause any problem. And yeah, the Secretary of State came to Carol and said, if this passes as is, we can't issue birth certificates anymore. And that was not the intent. I was on the commission with Senator Rosenwald. This bill came out. And the idea was, right now, you're required to give all this, the mother is required to give all this personal information. And there's actually a criminal penalty if she doesn't or knowingly, if she refuses or knowingly provides certain information. And the original bill limited it, you had to provide accurately only the information required to create the birth certificate. Because you can create fraud.
Does not involve the health.
Yeah, it's basic background,
Yeah.
health, or something like that.
You can't do it. You can't even do it.
So, Carol, can you send in copies of the amendment to 105? I took a quick look at it on my phone. I didn't end up printing it.
Do you want me to go upstairs and get some?
Yes, please. I thought I had a bunch. I do have there's a stack of them over there.
Oh, okay. And I just sent the amendment for 147 up to committee services, so.
Well, yeah, I got copies already. They should be there.
Oh, yes, exactly.
Is he getting enough for everybody?
Are there enough, Tony, or do you want me to go get copies?
Oh, yeah, sure, Jane.
Don't sit down.
Welcome back. I'm opening the hearing on Senate Bill 108, and I call Grant Bossy for Senator Carson.
Thank you, Madam Chair and members of the ED&A Committee. I'm Grant Bossy from the New Hampshire Senate, introducing Senate Bill 108 on behalf of Senator Sharon Carson, the bill's prime sponsor. As you well know, New Hampshire's public defender program has a recruitment and retention problem, something that most businesses and government agencies are currently facing. A recent survey of public defenders found that high caseloads and low salary were the two biggest challenges, but access to health care ranked third. SB 108 would allow public defenders to opt in to the state health plan, providing both better coverage at lower cost. And since this is a 100% general funded program, lower cost would mean savings to taxpayers. The Senate amendment changed the effective date from 60 days after passage to upon passage. This is in order to align with their current insurance contract, which expires June 30th. SB 108 received unanimous support from the Senate ED&A and Finance committees, as well as the full Senate. It's an important tool to help fill vacancies in our public defender program, lower caseloads, and cut into the backlog of 650 cases now pending. Senator Carson thanks you for your consideration and asks for your support of Senate Bill 108. Thank you.
Thank you. Are there questions? Representative Lekis and then Rhoda.
You said that this was general funded, which seems to imply it's funded from the general fund. I'm suspecting that's not the case. Would you like to indicate where the money comes from?
I was told that this was a general fund appropriation. I could be
Is
wrong
it?
on that.
Oh, is
I'm
it?
sure there'll be people back here to clarify that.
All right, that would be good.
Representative Rhoda.
Could you restate what the number 1 and number 2 reason for leaving?
Yeah, I don't have the survey results in front of me, but they were 1, high caseloads, and 2, salary. And then third was healthcare benefits.
Yes, Representative Gould.
So the hope is that by offering this additional benefit, you'll be able to recruit and hire more public defenders, which will lower caseloads and attack item number 1.
That is the hope. I don't think Senator Carson believes that would solve the problem completely, but it's another tool at the margins to get people into the public defender program instead of going to another practice.
Thank you, and thank you, Madam Chair.
Okay. Any other questions? Thank you.
Thank you.
Sarah Rothman. You just turned your mic off. There you go.
I apologize. Good morning. My name is Sarah Rothman. I am the Executive Director of the New Hampshire Public Defender. I've been at the Public Defender for 15 years. As you likely know, there are both federal and state constitutional requirements for the state to provide legal representation to defendants who cannot afford an attorney. We fulfill that role in New Hampshire. So we contract with the state, we contract through the Judicial Council to provide representation to every indigent defendant in our court system. We represent well north of 80% of all criminal defendants in New Hampshire. In New Hampshire, in addition to the constitutional requirements requiring that we exist, there's actually also a statute in New Hampshire that requires the state of New Hampshire to contract with a firm to provide this representation to indigent defendants. We were founded in 1972, so we've been in existence for 50 years, and we've contracted with the state since 1985. We've been the provider of these services to the citizens of New Hampshire. We're here today asking you to approve this legislation because it will benefit all stakeholders in the criminal justice system. All stakeholders. That includes judges, court staff, city and county prosecutors, victims of crime, and defendants are impacted by retention problems at the New Hampshire Public Defender. When NHPD cannot retain its staff, it results in delays and logistical problems for everyone involved in the system. When we struggle due to staff attrition, it makes it more difficult for everyone in the system to do their job. So we aren't just asking you to help improve the lives of our employees. We're asking you to help the criminal justice system in New Hampshire to function. Since fiscal year 2021 alone, 140 employees have left the New Hampshire Public Defender. 52 employees left in fiscal year 2022. That's an average of 1 employee every single week. So far in the fiscal year 2023, we've lost 43 employees, and 22 of those have been attorneys. Every time we lose a staff member, we have to devote substantial resources to recruiting, interviewing, and most importantly, training new staff members. When we lose attorneys and when we lose investigators, their caseloads must be transferred to already overburdened colleagues. And this then fuels more attrition. We need to break this cycle, and this legislation will help us to do that. Why has attrition spiked at NHPD over the last 4 years? It's because the benefits that used to draw people to the public defender and keep people at the public defender have eroded over time. Our health insurance has become more expensive for our employees, and the quality of the benefits has decreased. The state health plan will keep people at the New Hampshire Public Defender. We are competing in a historically hot job market with private sector and with neighboring public defenders, organizations that offer better pay and benefits. We will continue to struggle with attrition if our staff can leave for a public defender program in a nearby state that has a more attractive benefits package to offer. I want to tell you that as the executive director of the Public Defender, I am incredibly confident that this legislation, the ability to join the state health plan, will help retain our staff. It will keep people. I hear that from people regularly. That yes, caseloads are an issue. I know that was discussed earlier. Caseloads are an issue. But again, as was pointed out, if we're able to retain and recruit staff, that will help with caseloads. But what we hear quite as frequently is that I could deal with the caseload. I understand that, public defender has high caseloads, but if I had better benefits, particularly if, going to the doctor was not sort of a frightening event where I could be stuck with a large bill, where having a child is not so difficult to do while you're working at the public defender. We hear that over and over again, that benefits will retain our staff and help us recruit our staff. So our employees have been clear, healthcare is a priority for them. The ability to join the state health plan would be a game changer for the public defender. It will draw people to NHPD and will keep people here. And again, this is a benefit not just for our employees and not just for the clients that we represent. It's a benefit for the entire criminal justice system. If NHPD can better retain its staff, all stakeholders will benefit. Thank you again for your time and for considering this legislation.
Thank you. Are there questions? Representative True.
Thank you, Madam Chair. Thank you for taking my question. On line 6 of the bill, page 1, the public defender program will reimburse the state for the premiums. Where do you get the money from?
Sure.
To reimburse the state?
Sure. And so that ties into the earlier question. We are funded through the general fund. We are 100% funded through the general fund. And so it's kind of an interesting kind of just cycle. So we get funding through the state and then we pay the state for the health insurance through our budget.
So you're laundering funds from the general fund to the employee benefits fund.
Essentially.
I see. Okay. Representative True, you have a follow-up.
Thank you, Madam Chair. And on the last line, on the last 2 lines, public defender program opts in. If the public defender opts in, it should be for 2 years.
Correct.
It sounds like you're not holding people even for 2 years.
So, I mean, certainly, yes, we're dealing with attrition for sure. I mean, certainly there's been employees who've been here for, we have some, I think our longest serving employee has been here for 36 years. So we have plenty of staff that have been here for a long time. But I think the 2 years is just that, and frankly, I think if we are able to join the state health insurance, I don't think that we would ever leave the state health insurance. It's just so that we don't sort of burden the state with getting on the plan and then choosing next year to get off the plan and then going back on the plan. I think that they wanted some guarantee that if they're going to do the administrative work to get us on the plan, that it will be for at least 2 years. But like I said, I don't envision, us ever going back to private health insurance if we're able to join the state plan.
Thank you.
Representative Lacus.
Thank you. So I looked at the fiscal note and I understand why, it's difficult or impossible to come up with a precise answer because there's, variables, size of who opts in, their characteristics and all that. However, I have a problem voting for something where there's just no clue. I mean, there should at least be possible to have a range of possible costs to this thing. And I can't see how to vote for it without at least some idea. So if somebody could provide that, I don't know if that's you or someone else, it would be helpful.
I can't give you the range right now. I can certainly follow up, but I can speak to that issue a little bit as well. But we can follow up with a range. What I can tell you is the healthcare costs will certainly be cheaper for the employee, and it will be cheaper for the New Hampshire Public Defender. The only issue that could cause cost to increase is that we do expect, because this is such an attractive benefit, that people who are currently not receiving health insurance through the Public Defender, so either through they get it through their spouse or through some other source, might join our plan because it's a better plan. But I can also tell you, one of the reasons why it's hard to pin down a number is because currently with private health insurance, not only is NHPD covering premiums, we're also covering a percentage of claims. And so that we will no longer have to do that under the state health insurance plan. So the increase in cost that we anticipate potentially based on increased utilization of our health plan will be offset, I don't think completely, but will be offset by the idea that we are no longer going to have to be paying a percentage of claims.
Follow up?
Follow up.
Okay, yeah, it wasn't clear to me how things currently work, who's paying for the health care and how this changes that. So it sounds from what you just said that, that NHPD is already paying for at least some portion of their health care. How does it work now and how would that change?
Sure. So as we're funded through the general fund, we are literally just given a budget, and then we have to use that budget to pay all of our expenses. And so we use our budget to pay for healthcare. And we contract right now, it's through Cigna. And through Cigna, obviously we have premium costs. NHPD covers, I think it's around 92% of the premium cost. The employee pays 8% of the premium cost. And then the employee pays a percentage of the claims, and we pay a percentage of the claims. NHPD pays a percentage of the claims. But all of this, because we're from the general fund, one way or the other, it's all paid through state funds. It's just, it's a line item in our budget that we use our funds to cover.
Follow up.
So, I mean, they're getting health insurance, and HPD's paying, it sounds like, probably for the bulk of it. I don't know what percentage overall. So how does the cost and who pays what part of it change if this were to
Sure.
pass?
So the premium costs are just lower under the state, so both to NHPD and to the employee. So the cost for, say, a family plan is cheaper under both for NHPD and for the employee. So the healthcare costs are actually lower for NHPD under the state plan. It's just the idea that because it's an attractive benefit, we might see increased utilization. But so we currently pay, like I said, the premium and then a percentage of claims. Moving forward, we're just going to be paying premiums. And another reason why it's hard to pin down a number is because, if we're able to join the plan, then there's a period where, we can negotiate premiums. And so we don't quite know exactly what the premiums are going to be as well.
Follow up, if I may.
Perhaps if you could mention little details like how many employees you have.
Sure. Yes. So we have, I think the count today is, it's, I think 251 or 252 employees.
Okay, thank you. Representative Lekis, your follow-up.
Okay, so from what you're saying, the savings both to the department, which might be offset by more people, being involved in the plan, and to the employees is because, as I understand it, the premiums are going to be less, and you and the employee don't have to pay a portion of the claims. Is it going to go down because you're joining the other plan? It's a larger group, and therefore they get better rates, or?
I think that's possible. I'm not sure.
The state
you saying
plan is self-insured. The state pays the claims.
That's correct.
Okay, thank you.
Okay, I have a question. On line 8 and 9, it says the public defender shall be permitted. Is that your organization or is it each individual?
It's our organization. Yes. Yes, we're not going to engage in, yes, we will either be able to join the state plan or we will have to stay with private insurance.
Okay, thank you. That wasn't entirely clear.
Okay.
And all right. I'm kind of surprised at the premiums being lower unless you're very high risk, because I was on the state plan as a legislator for a few years, and it was, although it covered a great deal, it was also a very pricey plan. And has that actually changed?
I mean, comparatively to what we're able to get in the private market, it is considerably cheaper.
All right, thank you. That's interesting.
We are a relatively small organization, so our bargaining power, we're only about 250 employees. And so when we go out and get a private contract, we don't have a great deal of bargaining power because we are a small organization.
Okay. Representative Peroda and then Matt Gould.
So I think that, correct me if I'm wrong, the way I'm understanding this, that this bill would allow your group to join the state employee health plan, and that it would reduce the cost of the overall health care for your employees because you wouldn't be paying the premium and you'd be paying a lower rate.
Correct. I mean,
Okay.
the employee will still pay a percentage of the premium. Yes.
And then if you choose to opt into this plan, your employees could choose to opt in themselves, right? They're not necessarily, will they be required to join the health plan? Or they can go out in the market and get their own.
Correct. I mean, we're not going to offer both the state plan and a private
Right.
option. We're only going to offer the one option.
Okay.
But correct, they could either get insurance through us or through their spouse, or on their own if they wanted to.
Right. Okay, thank you. And I believe, if I'm not correct, if I'm not mistaken, follow up, excuse me, I just wanted to, that the state employee plan that state employees are on is less expensive than the ones that we are offered as state representatives. I think that's, no? Is the same exact one?
They are less expensive than what the public defender program is able to buy as a small group in the
Oh, okay.
private market.
All right, thank you.
Okay. Representative Gould?
Well, I would just add on to that. To what Representative Grody just said, Madam Chair. What I had heard was that as a rep, I can buy into the plan, but I don't get the state employee rate. That I have to pay the full rate. I don't get some of the
No
reimbursement.
subsidies. No,
And so
no.
they will be getting that lower rate of the state employee that we don't get as representatives. That may be why you noticed a difference.
That
That is correct. And I can also point out, would not be the only non-governmental agency on the state plan. They have a group called the Statutorily Authorized Groups. They call us a SAG. So yes, there are other organizations that are on the state plan who are not state employees.
Thank you, and I think that may be the difference. Legislators, is Representative Horrigan.
Thank you very much. Yes, when I was, yes, I never paid into the state employee plan. When the Affordable Care Act came in, I found that was a better option, but that's just probably not an option for for employees. And now I'm on Medicare. And you mentioned the Cigna plan. So my question is, first of all, how is your overall cost of labor going up? Because you're trading off probably better health insurance plan for the salary, and then also what do you planning to offer your employees? Or is that still subject to negotiation for if this bill should pass and they accept you to the plan and all that? So what will their copay be, and what will you be paying?
So that is to be determined. But I think from what I've looked at, it's a significant savings to both staff and, as I've said, and to NHPD. The premium for us is cheaper as well. But was there another question I can answer? I apologize.
They don't have I guess just the way the ACA is structured, they don't have the option of buying an ACA plan instead of yours, or do they?
They do not have the option
Yeah.
to buy subsidized ACA plans, which is a big difference. Yes, Representative Smith.
Thanks.
If I'm reading this correctly, apparently there's like 245 employees right now in your agency, and 201 are on the plan already. So you're talking 40-some people, give or take.
That's the potential. And again, I don't think we expect every single one of those. Some people are married to people who already have state health insurance.
Right, that's right. So we
and-
may be just talking 20 people.
Correct.
Something like that.
Correct.
Okay.
Yes.
Okay. Representative Simon.
Thank you, Madam Chair. Just a quick clarification. 252 is fully staffed, or what you have on staff at the moment?
That's what we have on staff at the moment.
What would fully staffed look like?
Given we do rehire when we lose people, so we are actually right now not bad. I mean, I think we would like to add, every fall, we get a new group. We're having 19 new lawyers that are starting in the fall, but we do expect attrition between now and then. So usually, you know, it kind of plays out around, we like to be around between 250 and 260 employees.
Thank you.
Okay, other questions? Right, thank you very much.
Thank you.
Gregory Erskine.
Is the microphone on? Yes.
Yes.
Hi, my name
You
is
have
Greg
to talk
Erskine.
close to it. You have to be
Pardon?
close to the microphone.
My name is Greg Erskine. I am a stay-at-home father of 4 and resident of Manchester. I'd like to thank this House committee for allowing me time to speak. A couple of months ago, my wife Heather and I moved here from Kentucky, where we lived for the last 8 years. We had moved there because my wife was hired by the Louisville office of the Public Defender, and we've just moved to Manchester because she was hired by the New Hampshire Public Defender, so SB 108 is a bill that would impact our family greatly. One of the reasons that we decided to uproot our lives and move to New Hampshire was because New Hampshire's office seemed more efficiently run than Louisville's was. So this bill, which is likely to give the public defenders a better health plan, is exactly the kind of lure that would bring in the best and brightest from all over the country. But the other reason that we wanted to move to New Hampshire is that it is my home. I was born in Concord Hospital. I was raised in Manchester. I was educated in Manchester's public schools. My parents were likewise lifelong residents of Manchester, as were my 4 grandparents. And I am overjoyed to be back in my beloved home state, and I am happy that my wife's work can serve the state that I love so deeply. And I feel extraordinarily blessed to be able to raise our kids here. We do our best to keep our kids healthy with regular checkups and good food and running around in fresh air, but one can't always prepare for every eventuality. Last summer, our 5-year-old complained that her back was sore. We asked the doctor about it. She said it was likely nothing major, just keep an eye on it, and the problem continued to worsen. Eventually, x-rays showed severe damage to her lower spine. No one knew why. The spinal surgeon who examined her said he'd never seen anything like this. So the doctors ran tests, scans, biopsies. I spent many nights with my little kindergartner in the hospital. Eventually, it was determined that it was a bacterial infection, which could be treated with antibiotics, although the damage to her spine remains. This experience brought home to me that there are some severe illnesses that you can't prevent or prepare for. They befall us, and we can only hope that there are medical professionals that can help, and that your insurance out-of-pocket maximum doesn't ruin a person financially. If SB 108 passes, the switch from NHPD's current insurance to the state employee program could save a family like ours thousands of dollars in the event of an unforeseen medical emergency, such as the one that we experienced. We moved here because my wife's job allows her to serve the most vulnerable citizens of New Hampshire. SB 108 is legislation that will help working families who are here to make New Hampshire a better place for everyone. Thank you so much for your time.
Thank you for your testimony and welcome to New Hampshire.
Thank you.
Are there any questions?
Welcome back.
Excuse me. Yes, thank you, Representative Schmidt, for that clarification. I don't see any questions, so thank you.
Thank you.
Ilian Forsanidi.
Good morning. And thank you for giving me the opportunity to speak today. My name is Eliana Forsanidi. I've been with the New Hampshire Public Defenders for 11 years now. As a senior staff attorney, I have a mainly felony-focused caseload, though I've represented individuals from everything from juvenile cases to murder. Along with that caseload, on top of it, I also, for the past 3 years, have been a member of the trial skills team. Recently I was promoted and now I'm the trial skills team leader. As a member and now leader of trial skills, that means I am the individual responsible for leading trainings for our incoming class. So as Sarah spoke about, each year we have an incoming class and I'm one of the people that's responsible for training them on how to be a trial lawyer. My husband, actually also works for the New Hampshire Public Defenders as a staff attorney. He has been with the program for 9 years. I also have permission to speak on behalf of 2 other individuals who could not be here. Sarah M. Cherry, who has been an investigator with the program for 15 years now, and Kara Samard, who was with the program for 9 years before she left in December, due in part to our health care plan. Both of those individuals did submit written testimony, and I do hope that you have the opportunity to read that testimony, because I will reference it, but I cannot speak as eloquently as they can about their own experiences. One of the things that the 3 of us have in common is that we all 3 had children while employed at NHPD. For me, that happened in December of 2021 when we welcomed my daughter, Catalea Eva. I've always known that we've had a high deductible. When I first started, it was much better. Everything was covered. We didn't pay as much. I didn't use it. And so when I had my daughter, it was really the first time I had to use our health insurance. And as fortune would have it, because of the pregnancy, the way, the time frame of the pregnancy, I got to use it twice because I spanned 2 plan years. So I paid $1,000 for a relatively easy pregnancy. And then because I did have an emergency C-section, I paid, I maxed out our deductible and our out-of-pocket max and had to pay $5,000 for that. On top of that, when I got home from the hospital, you're in the hospital, the doctors are telling you your baby needs this. You're of course saying, yes, of course, it's in-network hospital, it was in Portsmouth. And lo and behold, apparently one of those providers was out of network. And so Cigna was refusing to cover it. And so on top of being home, having to deal with postpartum and a new baby, I also had to be fighting with the health insurance who are trying to not pay for something that they should. This is my experience, and why I think it's important to share, and what I think it's important for all of you to know, is that, in terms of my 5-year plan, I certainly want to have another child. I need to think about whether it makes sense for me to knowingly have to pay another $5,000 to have another child, to stay at a job that I love. I mean, even now, I hate to admit this, but when my daughter comes home from daycare and she has a cold, I need to think to myself, is it really worthwhile to go to the doctor with our really high costs? It's $100 to $200 each time I have to take her to the hospital or to the doctor, not the hospital. But and so it's something I have to think about, and I hate that I have to think about it. And when you look at the stability of the program, what we really need in terms of retaining lawyers is we really need lawyers in the 3 to 5 to 8 year range. This is the core of the program. The reason for that is because at that point, they have a full caseload. They don't need as much supervision as they needed before. And they're starting to mentor new lawyers. Either formally through our mentoring program or informally as just, sometimes a new lawyer doesn't want to ask someone with 11 years experience a question. They feel more comfortable going to someone with 3 years. And so it's really important to have those lawyers in the office. And when we don't, we send out these new lawyers. We get a new shiny, new class. I love interacting with them. They are so excited to start working at the program. And it's a great program. But we send them to these to their offices, and they don't have the support that they need because there aren't these more experienced lawyers there, and they're getting cases that they just cannot handle, and that they wouldn't be getting if we had those lawyers in the 3 to 5 to 8 year range. And so they leave as well. These would be people that we wouldn't be losing if we could retain the lawyers in the 3 to 5 to 8 year range. These same lawyers who are probably thinking about having a family. And they're thinking about whether it's worthwhile to spend $5,000 to have, at least, to have a family. The other thing that all 3 of us have in common is how hard our jobs are. Our jobs are really, really hard. Not just the secondary PTSD that Sarah talks very eloquently about, and so does Kara, but also just the emotional toll of our cases. When I go to trial, sometimes I'll wear a fitness watch, and my fitness watch will tell me that I have run a marathon. because my heart is racing, my anxiety, I'm not sleeping, I'm not eating. And that's what's required because I have to care about my clients in order to do the job that I am hired to do and that I love doing. But that's really hard to do, and it's really hard to do when I don't have access to mental health care. I don't see a therapist. My husband does not go to therapy. Because again, if I'm making a decision of taking my daughter to the doctor, because it would cost $100 or $200, I'm not going to make the decision to go to therapy when it would cost $60 to $100 for me to attend a session. And you see that in all the lawyers and a lot of the lawyers who have been there as long as I have. They're not receiving the mental health treatment that they need. Thank you. Sorry. It's also really important in terms of recruiting new lawyers. Kara talks a lot about this. She actually works as a clinical professor at UNH. She is basically training our incoming class before they even get to us. And she has seen that there's a movement in the universities towards the well-being of lawyers and making sure that they have access to mental health care. And so you see the incoming class expecting that care, expecting that they're going to be able to attend therapy. And they ask me about it when we're doing new lawyer training. And I have to be honest with them. And I have to say to them, you're probably not going to be able to afford to go to a therapist on your salary. I can't afford it on my salary. And that's really hard for them to hear. And if there are other programs or other jobs that are offering that, we are going to lose lawyers that are the best and the brightest because of that. She wasn't able to submit it prior, but I also got a letter from Eva Farakis, who is a new lawyer. She just started in the national office, who writes about that, who writes that she saw the benefits packet and thought about not coming to NHPD because of it, but decided that she was going to make do. But she was attending therapy and is no longer, and at times has had to go to the doctor and hasn't because she can't afford to go. In summation, I do think putting us on this bill will help us retain and recruit lawyers. That is how we can lower our caseloads. That's how we can lower overall costs. As Sarah said, it takes a lot of time, effort, and money, resources to train a new lawyer. If I leave the program, you can't just hire someone to replace me. They can't take my caseload. It's going to take years before they can take the cases that I have. And we're not going to be able to recruit some of the best and brightest who will stay and who will want to make this program as good as it is. And again, it is a great program. And it is, we're such a small state and we have such a great public defenders. And I just want to stay to make it better. Thank you.
Thank you very much. Questions? Seeing none.
Thank you.
Leah Krauser.
Good morning. I don't generally have a problem with my volume, so let me know if I'm wrong about that. I've worked as a staff attorney at the New Hampshire Public Defender for almost 7 years now. During that time, I've seen turnover. At first, at a normal rate, something you can expect, something that's in every kind of job market. But then as the years went on, the pandemic complicated the judicial system, stalled the courts, and strategic choices were made, caseloads skyrocketed. And I mean that. I was over 2.5 times my expected caseload. Mental health plummeted as a result, and job satisfaction faltered and deteriorated. We've lost far more than 1/3 of our attorneys in this short amount of time. And not just attorneys or bodies to take cases, but the institutional knowledge that goes with them. The ability to train the new class, to mentor them, to keep them on. At my 7-year mark, I am currently mentoring 2 new attorneys. That is strange, it is uncommon, and it is a huge time commitment. I am responsible for my caseload, but also theirs, their appearances in court, their clients. And why do I have to? Because there's no one else to do it. We have no mid-level attorneys that have the experience, the time, the mental energy to do this. The more we fail at retention, keeping people in my experience level, in Eliana's experience level, the more caseloads will rise and the more people that will leave because the job is just that hard. It feels like a never-ending cycle, but we're at least starting. We have a glimmer of hope to change that cycle. Many attorneys and staff members have written stories or come to me about their current experience with our health insurance and what it would mean to be on the state health insurance plan. They've talked about the harm our insurance has caused them and their families, and the promise this bill offers. And I want to echo that while caseloads are a really big concern, and salaries are also a really big concern, health insurance is part of the entire compensation package. Salaries take into account other benefits, and people can live with less if they receive the health care that they need. The first story I want to talk about is from a staff attorney that left New Hampshire Public Defender last year. She left in very large part due to the complications from our health insurance. The beginning of her affordability issues with the Public Defender's Office began toward the end of her first year of employment when she tried to enroll in therapy. At the time, she says it was partially because I needed it and partially a preventative measure because she knew how hard the job could be. She wanted to make sure she had the help in place for when she needed it and her caseload got more serious. Therapy visits cost her $80 per visit, even with an in-network provider. With a beginning salary on the New Hampshire Public Defender salary scale, she could only afford one visit per month. She made the choice against her doctor's recommendation to only go once per month because that's what she could afford. On the state plan, she could have afforded weekly visits and the monthly cost would have still been lower than her one session. In her second year, she had an emergency hospitalization that caused her to hit her deductible all at once, resulting in thousands of dollars of bills she could not afford to pay. She was living paycheck to paycheck as an attorney with the New Hampshire Public Defender, and this put her over her budget. She was lucky that she had a family that could help, but she talks about the embarrassment of having to go to them for help. She was the first generation that had professional degrees, and she couldn't even support herself or get basic medical care. She knew when she went to them, she was going to have to defend her decision to work as a public defender in New Hampshire to them because she couldn't support herself. Under the state health insurance plan, she says that her deductible would have been low enough that she could have afforded the emergency hospitalization. When she returned to work, the stress from both the job, the time off, and the added bills compounded the already stressful work, and it solidified her decision to leave and seek other employment. She could no longer afford her job at the Public Defender. The second letter or story I brought to talk to you about is from someone who is still at the New Hampshire Public Defender, but her ability to stay at the Public Defender is directly tied to the bill before you. She's been at the Public Defender for 5 years. Her coworkers, she says, are like her family, and it's what kept her here. But in summer of 2022, she couldn't put off medical appointments any longer. She had heart issues that she could no longer ignore. Her cardiologist and gastroenterologist requested multiple procedures and testing in order to get her a diagnosis. Our health insurance denied the procedures her doctors deemed were necessary. They found a mass in her stomach, but Cigna would not pay for the more precise diagnostic test to determine its nature because, quote, there was no proof the mass would grow in the next 12 months. Not having a definitive answer has led this coworker to take more leave, more sick days, and has impacted her ability to do the job. It has put a burden on her coworkers and the rest of the employees, and she has the added stress of not knowing what's going on with her own health. Based on this alone, she says it's difficult to stay in the job and to not look for better benefits elsewhere. I have seen multiple lawyers in my time here leave because of the benefits package, or at least a component being the benefits package. The mental health care that is necessary to do this job appropriately and not burn out and be able to stay at this job is high. It requires us actively seeking those services that are financially kind of out of reach from what we're able to pay. I fear new lawyers who start and encounter a similar experience as those I've talked about may be discouraged from remaining here long term, from choosing to have children, like Eliana has said, or from not receiving the medical care they need to be able to stay in the job at all. The bill before the committee can make a meaningful difference. It can stop the hemorrhaging of attorneys at the New Hampshire Public Defender and keep attorneys, support staff, and be a real benefit in recruitment. It can make us competitive with other state agencies and other public defender agencies that are taking our staff that we have trained and that we cannot keep within the state. I'd ask you to consider these stories and others that you will hear, and I really thank you for your time.
Thank you. Are there any questions? Representative Abear.
Thank you, Madam Chair. If my question is not appropriate, please let me know. Would you were talking about deductibles. How much is a family plan or a single plan that you pay now?
I don't know the answer. I'm not on our health insurance.
Okay. Very good. Representative Forian, do you have a question?
Yes, when the attorneys leave the public defender office, where do they typically go? Is it to a private conventional attorney firm or a different area of law? Where are they going?
I think it depends. Most attorneys I know are going to state agencies in New Hampshire or Massachusetts, where they get the state health insurance, or they're going to CPCS, the public defender in Massachusetts, or they're going into private practice or working in small firms.
Almost
Thanks.
anywhere. Okay, thank you. Other questions? Seeing none, thank you for your testimony.
Thank you.
Is there anyone else who wishes to testify on Senate Bill 108? All right. Seeing none, I will close the public hearing. We are into the time for the next bill, so we will consider this at our executive session this afternoon. We don't have time to do it right now. So I'm opening the hearing on Senate Bill. Yes. Sure. Yes.
Thank you, Madam Chair. I just want to make a comment to all the public defenders. I've sat here since January, and this is the first time I've cried through testimony. Having worked in juvenile justice, my friends all wondered why I didn't get on the Child and Family Committee. I just want to say I feel your pain. I know the work you do, and thank you. You're the heroes in juvenile justice.
Okay. So I'm opening the hearing on Senate Bill 105, and I call the sponsor Senator Rosenwald.
Thank you, Madam Chair and members of the committee. For the record, I'm Cindy Rosenwald. I represent Senate District 13, which is most of Nashua. And I'm pleased to introduce Senate Bill 105. This bill grew out of a study committee last summer and fall, and the House co-sponsors were members of that subcommittee with me. So when a woman gives birth in New Hampshire, the Division of Vital Records, which is located in the Secretary of State's office, collects information needed to issue a birth certificate. However, the form the mother is required to fill out for the birth certificate also forces her to divulge some very personal information to the Secretary of State, such as how much she smoked while she was pregnant, how much alcohol she drank, and even how much she weighed before she got pregnant. And the form tells her it's a felony to lie about any of this. I've given you all a copy of this form. Vital Records doesn't want it to be made public, but I've highlighted some of the questions mothers are asked to answer. And I've also highlighted the felony warning for lying, which occurs most of the way down the page on the mother's worksheet for the birth certificate. So you are forced to divulge your personal habits and some of your medical history under threat of criminal penalties. As if this is not intrusive enough, sometime after the mother goes home, the hospital or birthing center sends out more identifiable confidential health information from the mother and her baby's medical records to the Division of Vital Records without her permission and most likely without even telling her. This information includes when was her last period? Does she have a sexually transmitted disease? Is she breastfeeding? Even a little bit. Did she have fertility treatments? Was it a vaginal birth? And many other personal questions about her medical and social history. Again, I've highlighted some of this personal identifiable information taken from her and her baby's medical records and sent to the Secretary of State and the Centers for Disease Control. And those questions are on the facility worksheet that follows the mother's worksheet. State law in 332-I has long made clear that the information in someone's medical records belongs to that person. The provider owns the physical record, but the individual owns what's in it. And the sentence could not be more clear. And it's long time state law. So let me emphasize that. The information in someone's medical records belongs to them, not the hospital, not any doctor, and not the government. Furthermore, a few years back, 5 years ago, more than 80% of voters amended the New Hampshire Constitution to include a statement that Granite Staters have the right, quote, to be free from governmental intrusion in private or personal information, end quote. Providers that release a patient's medical information not for the HIPAA purposes of treatment, payment, or essential health care operations without that person's consent are violating 332I, and I believe they are also violating the New Hampshire Constitution. We should, I think, be further concerned about the invasion of privacy and the security of this medical information released to the Division of Vital Records because the Secretary of State's office is not covered by HIPAA. I don't have any concerns about their internal management controls at all. However, any hacking or breach of their systems would not be subject to the investigative, enforcement, or penalties in HIPAA. The individual whose confidential medical information was wrongly accessed would have no protection at all. And what I think is an unauthorized, clearly unauthorized disclosure of individuals' medical history is not limited to state government. For 2 years during the study committee and through the Senate phase of work on this bill, both the Division of Vital Records and the Division of Public Health in the Department of Health and Human Services told us that only de-identified information on mothers is sent to the National Center for Health Statistics, which is part of the CDC. That is not the case. All of this identifiable health information is sent to the federal government, omitting only her name. her address, her date of birth, her place of birth, among other identifiers, is sent to the federal government, making it very simple to identify individual women and tie that to their medical histories. I have read the CDC's instruction manual for hospitals on how to fill out the birth worksheets to send to the federal government 4 times. I didn't give it to you, but it's incredibly detailed. It has 8 different ways diabetes has to be reported and 9 different classifications for reporting hypertension. For artificial insemination, it requires hospitals to report whether the sperm is from the husband or a donor. And remember, this is identified information with the mother's, all of her identity except her name. But nowhere in its 59 pages does it require that identifying information on women who give birth be disclosed to the CDC. But yet we send it for about 25,000 mothers and babies in New Hampshire every year. Now, I would like to ask the men on this committee to imagine for a moment, what if you had, let's say, erectile dysfunction, or perhaps an enlarged prostate causing frequent urination, or you like to have a few drinks, or maybe you're somewhat overweight. And this information with your identity attached was disclosed to the Division of Vital Records and the federal government without your permission or even your knowledge. And then, in the possible event of a breach, there were not even the protections of HIPAA. I don't think you would find this acceptable, but that's the situation the women of New Hampshire are in. So Senate Bill 105 aims to rectify this situation in 2 ways. One, it decriminalizes the mother's worksheet that she has to fill out. And remember, you fill it out, you're not in the hospital for very long, a day or 2. You've just had a baby. Maybe you're tired, maybe you're overwhelmed, maybe you're more interested in your baby. So it decriminalizes that information should you decide not to report what you weighed before you were pregnant. And it de-identifies the information the hospitals release to the Secretary of State, the Division of Vital Records, which is also released to the CDC. Senate Bill 105 recognizes the importance of de-identified data that DHHS and doctors who do research use to understand maternal and child health in New Hampshire. They will still have access to all the categories of information they currently get. How many women have cesarean sections, have fertility treatments, have gestational diabetes or other complications, use drugs, the number of babies born with exposure to substances that have to be reported to DCYF. They just won't have identifying information along with those records. And let me reinforce also that all this health data will still be sent to the CDC. They just won't get the identities of New Hampshire's mothers and babies involved. Now, you'll be hearing from the Department of Health and Human Services and some doctors and clinics, they're all behind me. There's a large group this morning that they're worried about losing federal money and the impact this might have on public health programs. I recognize the importance of federal grants. As for the threat of losing federal grants, I have been here long enough to remember a long and drawn-out debate on the House floor about all the federal money we were told we would lose if we did not pass a mandatory seatbelt law. Needless to say, you know we didn't pass it, and we have never lost those federal funds. I personally worry that the department and some doctors are more concerned about the loss of money and their own work than they are about invading the privacy of women and babies and taking something that does not belong to them. Mr. Chair and members of the committee, we must remember that someone's medical information belongs to them, not the hospital, not the doctor, and not the state of New Hampshire, and certainly not the federal government. In the end, it is their constitutional right to be free from governmental intrusion in their private or personal information, and is also their legal right because under New Hampshire law, their medical history belongs only to them. Thank you. I'd be happy to answer questions.
Thank you, Senator. I'm sure there'll be some. Yes, Representative Lucas.
Thank you, and welcome.
Thank you.
So as a co-sponsor of this, I certainly supported the bill as introduced. What I'm wondering if you can enlighten us as to why the Senate amended it as it did.
So as you recall, the original version of the bill allowed the mother to refuse consent for her medical information to be disclosed to the Division of Vital Records. And based on testimony we heard from the department, that they thought it was very important to get a complete set of statistics. We amended it so that all this information still has to be reported to the Division of Vital Record for use by DHHS and researchers and doctors around the state, but it will be de-identified, so it really won't be personal to a particular individual.
Okay, thank you.
Representative Gerhard.
Thank you, Chairman. While I admire your efforts to keep medical information private, I was looking at an old New Hampshire Public Radio article when they were talking about the New Hampshire Veterans Home, and well, the Federal Department of Veterans Affairs was requiring 115,000 of their frontline workers to get vaccinated with the COVID vaccine. And in that article, it writes, late last week, Senator Cindy Rosenwald, the New Hampshire National Democrat, cited the same goal when she called on Sununu to require the staff in the state's veterans homes to be vaccinated.
Representative Gerhard, is this relevant to this bill?
I'm just concerned about the desire to keep medical information private, but requiring people to be vaccinated with a vaccine that's been proven to be a complete failure. I'm just
Thank you. Other questions? Seeing none, thank you, Senator.
Thank you very much.
Representative Turer. Eric Turer.
Thank you.
Oh, there it is. Okay.
Hi, thanks. I appreciate the opportunity to speak before the committee about this. I represent Brentwood. I'm also here basically representing as an individual who has, about 30 years of public health consulting experience with the state of New Hampshire, a variety of other states around the country, federal government, a lot of it focused on data analysis. I've worked with both vital statistics and with HIPAA protected information from the state, and I work on issues related to access to healthcare, including rural health analysis. I am here to oppose the changes as they are currently embodied in the amended bill. I think if the issue surrounds HIPAA there and if this data that's been discussed is not covered by HIPAA, I think that is a valid issue that probably should be addressed through a variety of means, but the content of the data versus the security of the data are two separate issues. HIPAA explicitly allows public health disclosure of personal health information. And birth outcome data, the full set of it is one of the most basic sort of fundamental public health statistics that's used across a wide variety of both programs and public health analyses. So I think the presence of the identifiable information in birth record data is inherent. It's critical to the use of the information. And the linkage of that data, the way I see it, is focused on two things that would be lost. One is the ability to link to geography. Statewide statistics are not particularly useful in this realm. And often we're looking for things at a much lower level. The other thing is linkage between the vital record data and other data sets, even down to the level of the linked birth death records that support infant mortality. There's a difference between the government having the ability to make those linkages and what is disclosed. So it's often the case that I will be asking for statistics that are at a level too sensitive to be released, but I can ask the government to aggregate these statistics for me and give it to me in an aggregated form that suits my purposes. One example is adhering to rural health definition used by the state. So we make a distinction between rural versus non-rural areas and aggregate the results. Though that is done at essentially a town or zip code level, depending on the definition. So we can re-aggregate those numbers based on the geography without actually releasing the specifics about it. So if you remove the identifiability of the data, all that leverage over the data is lost. So I'm essentially hoping that there's a way to step back from sort of the current proposal, get the data covered under HIPAA as it should be, and to keep the content of the information that's needed for public health purposes. There's a variety of ways in which that can be done. One might be rehousing the data in a different agency. The other might be what Texas is one example. They passed a law that essentially just said other entities. HIPAA is basically a floor for who has to adhere to these data security requirements. It's not a ceiling. House Bill 300 in Texas from 2011 is an example. It's a quite broad thing that they did. I'm not advocating that, but basically said that requirement extends to other entities besides sort of what HIPAA establishes if it can't be within a public health entity. So I guess in closing, I just want to say, working across the country on issues like this, I would hate for our state to be the one place where I can't obtain good public health birth information, particularly as we deal with adverse outcomes for births. Going back to rural, our state's lost 12 labor and delivery units at our hospitals in the last 20 years, one of them just within the last year. So the delivery system that ties to these birth certificates is very much under pressure right now, and it's very much important that we keep access to being able to tie all this data together. Being respectful for people's private health information. It's not easy. This data is not easily obtained when it's covered by the health department, but it needs to be accessible. I'll end with a really bad pun and just say, don't throw the baby out with the bathwater.
Thank you. Are there any questions? All right, seeing none, thank you for your testimony. Representative Horrigan.
And in your experience, do researchers go to great lengths to secure the data, and are they required? Which actually I know they are required to tell the agency that's given like the Vital Records Department here in New Hampshire and the other states, like what they're going to do with the data, what security measures they're going to have in place. Is there a process for reviewing and enforcing those precautions?
Thanks, Representative Horgan. Yeah, in my experience as an outside contractor to state government, obtaining data that's not in the publicly available record set, which basically means you're getting into some of the HIPAA protected fields that are contained in the data, requires a fairly extensive process by which you basically justify that the data that you're requesting is needed for the intended purpose. Also, HIPAA contains a minimum necessary standard, so they'll only disclose what sort of absolutely has to be contained in order to satisfy this question being asked. And we have to enter into essentially a business associate agreement, which puts us at, as an organization, my company, at great financial risk if we were to accidentally even lose or disclose that data. So it's kept on, encrypted servers with limited access, very compartmentalized when we're holding that information.
Thank you.
Thanks.
All right, I don't see any other questions, so thank you for your testimony.
Thank you.
Representative McDonald?
Chairman and colleagues, good morning.
Do turn your mic on, please.
Sorry.
And your companion, introduce yourself and your
As
companion.
Chairman of Health and Human Services here in the House, I'm always telling people, turn on your mic, and here I violated one of the cardinal rules. But that's great to see you all. Accompanying me this morning is Lindsay Bebo. She is the administrator of the Special Investigations Unit at the New Hampshire Department of Health and Human Services. I had the privilege of being part of that unit for 23 years prior to my retirement in June of 2019. I do have a prepared statement which I can give to the clerk if you want me to bring it up now or at the end of my testimony.
At the end will be fine.
Sure, great, thank you.
But it looks like we have a great number of people who want to talk to us, so please summarize.
Sure. It's a fairly short anyway. But basically, again, my name is Wayne McDonald for the record. I'm a state representative from Rockingham County District 16, which is the town of Londonderry. I'm also the chairman of the House Committee on Health and Human Services and Elderly Affairs. And I also, as I mentioned just a moment ago, had the privilege of working for the Department of Health and Human Services for 23 years as a fraud investigator in the unit that Mrs. Bebo currently oversees. I retired as a senior investigator in June of 2019. I'm fully aware of the privacy concerns that are expressed in this legislation, and I know it seeks to address and protect those concerns, particularly in this day and age of identity theft. How we use our personal information and to whom we give it and why has never been more important, and the need to be careful has never been greater. But there's a legitimate reason why government agencies collect certain sensitive information. And two great examples is the IRS and the Social Security Administration, and it's obvious as to why they need certain sensitive information. HHS here in the Health and Human Services here in the state of New Hampshire is no exception to that rule. The ability of, and speaking particularly from my background as a fraud investigator, much of that information that we were able to collect through various means and that this bill would hinder, would affect the ability of the department to pursue overpaid benefits and food stamps and cash assistance, child care assistance, Medicaid assistance. We know that the Medicaid expenses have never, it's important that we make sure everybody eligible for Medicaid gets it, but at the same time, we don't want to improperly administer benefits, and that's always a concern of any improperly administered benefits. Even if somebody is not on public assistance, the fact is that they could be aiding and abetting someone, and so some of the information we would be able to get could affect our ability to pursue somebody who nonetheless was jointly and severally liable for a public assistance debt. In terms of being able to find out where someone is working, if we have a court order, they aided and abetted in a welfare fraud. They're jointly and severally liable for this. Maybe they weren't on assistance, but they helped by lying about their whereabouts, whether they were in the home or something, or otherwise assisted in the commission of the fraud. So for that reason, this information is very, very important. I Much of the information we're talking about was important to me in 211 successful prosecutions of both a felony and a misdemeanor nature during my career. And it's very important in terms of safeguarding public dollars and honoring our commitment not only to clients as they relate to the department, but also to the taxpayer. The absence of this critically important information can also, affect child support in terms of their duties to determine paternity and pursue absent fathers and or mothers. Usually, it's an absent father, but it can be either one. Also, they have an interstate unit in the Department of Division of Child Support, and their ability to go across state lines and pursue people would be affected in that regard also. As far as the very legitimate concern over privacy, if I could go back to that for a moment, because it's something that concerns us all. It's important for all of you to know that all department employees are under very strict confidentiality requirements. The information the department gathers may not be used except in the confines of its specific official responsibilities. Personal information is not treated lightly, and it is not misused. It is further my understanding that no other state has imposed these types of restrictions as enumerated in this bill, and I suspect the reason is, in part, for the concerns I have expressed. And so my colleagues, in the interest of the taxpayers we serve, and for that matter, all of our fellow citizens, I urge you to amend this bill and remove Section 2, or vote the entire bill inexpedient to legislate. And that concludes my testimony, Madam Chairman.
Thank
I'm willing
you.
to take questions if you have any.
Representative Schmidt.
Morning, Representative. Good afternoon, Representative. It's past the noontime hour.
I return the greeting to you, Representative. Good to see you. So my question is, how many of the questions on this questionnaire, which I must say I find extraordinarily intrusive. I served for about 5 or 6 years on the Vital Records Privacy Board, which oversees requests for information, aggregated information, not individual identifiable information, but aggregated information regarding all kinds of things, births, deaths, illnesses, and so forth. So I understand the extraordinarily valuable aspect of comprehensive information that is collected about people. But I must say, I find this form extraordinarily intrusive. And my question is, how much of this can a person who's filling it out say, won't answer that, won't answer that, won't answer that? Because some of this stuff, I mean, Senator Rosenwald in her testimony hypothesized several questions that might be asked of a male, and many of them, just glancing through this, are, as I say, extraordinarily intrusive. And while it might be very interesting and vital or important for the state and the government to know about it, putting it all down on a form like this with your name, date of birth, social security number, and all that nails you down, nails the person down unmistakably, is like a ticking time bomb, I think, regardless of all the guarantees that you've referenced. It's a ticking time bomb because it has
Representative Schmidt, what is your question?
my
please?
question. I already asked the question.
Okay.
I already asked the question, but I'm saying that this is, once you put your name on it and hand it away, you've handed a ticking time bomb away, in my opinion. So what on this form can the mother, in this case, can she refuse to answer? She can't tell a
Yes.
lie according to the form.
Yes, thank you.
But can
Could
she-
you give him a space
can
to
she-
answer your question?
Yeah.
Representative Schmidt, the department could probably answer that better than I can. I don't know if you're able
There
to.
are several people from the department.
But it's my understanding that this section 2 that we're most concerned about restricts the ability of the department to collect the information but that, if I'm, can correct me, or perhaps someone else can who follows, that they can't be compelled to give some of the information, but that this would hinder the ability of the department to even collect it. And all of this, I can assure you, is relevant to the various investigations, over 2,300 investigations I conducted. All of this was very relevant, very useful, very carefully safeguarded, and it would be unfortunate to lose this information, you know, and be, you know, in terms of being able to collect the literally millions and millions of dollars that the Special Investigations Unit specifically was able to bring back to the state coffers. So I believe there is some refusal ability on the part of a client, of an individual, but in terms of the department's ability to collect this information, you know, it nonetheless is important. I don't know if I've answered your question, or I'm
No,
trying
that
to.
helps. Thank you.
Thank you.
Thank you.
Other questions? Representative Horrigan.
Yes, I am currently serving on the board that Representative Schmidt mentioned, and how do you, but, so I understand, you know, there's privacy concerns and you do protections in place, so how do you balance those against the fact that, especially when you have a health emergency like the COVID pandemic, it's useful to have very detailed information in order to combat a lot of the misinformation that goes around, like in.
Thank you,
Like-
Representative Horrigan.
Thanks. Like in the case of that, you had proof it was definitely, it was a respiratory virus and that there were excess deaths and.
I'm not.
Yeah.
In terms of misinformation, I'm not sure you mean if they provided false information. Is that what you mean? I'm not sure I understand your question.
Well, also, well, not so much that, but also sometimes people will espouse theories that aren't actually supported by the
Representative
public health
Horrigan,
data.
please don't hector the testifier.
Mean to do that? No.
And again, if the information they give us is accurate, it can sometimes support suspicions. If it's inaccurate, it's further false information that can be used in a potential prosecution effort or an administrative disqualification effort that would go through the administrative appeals unit. You know, so I was not in the unit during the pandemic, and I don't, Mrs. Bebo, if you're able to testify in terms of speak at all to how the unit functioned during the pandemic.
Well, I would like to clarify that if a mother does misrepresent or withhold information on this form, that is outside of the purview of what Special Investigations Unit does. We are not the unit that would try and enforce.
There are other
that.
portions of HHS that have said they will be testifying, so
Right, we can't testify to that.
thank you. Someone has a question? Okay, thank you very much.
Thank you.
Thank you.
Okay. And I would encourage the other people to focus their testimony. Mary Bidgood Wilson.
Want me to bring this up, Madam Chairman?
Please.
Good afternoon. My name is Mary Bidgood Wilson. I'm a family nurse practitioner and a certified nurse midwife. I practiced at Lakes Region for the last 35 years. Excuse me. Sorry. I practiced at the Lakes Region area for the last 35 years and was a member of the medical staff at Lakes Region Healthcare, now Concord Hospital, Laconia. Currently, I serve as the chair of the Legislative Commission on Interdisciplinary Primary Care Workforce. The commission was established in 2010 to plan and advocate for policy change related to maintaining and strengthening an effective primary care workforce in New Hampshire, with special concerns for rural and underserved areas. Members represent a wide array of health professionals and primary care. The New Hampshire Department of Health and Human Services will provide many examples of the consequences of Senate Bill 105 would have on many programs and funding. The impact of the data collection would be significant. The 2022 report on health status of rural residents in the health workforce data collection revealed maternal health disparities in our state. Primarily when comparing the Winnipesaukee area to the rates of overall rural and non-rural, the rate of no or late prenatal care is almost 2 times higher. Without access to this data from vital records, the state would have no way of assessing or tracking maternal health discrepancies in the state. This data allows public health to inform policy and target resources appropriately. Additionally, the vital health information allows the state to understand and track maternity care deserts. Birthing hospital location does not account for the distance traveled for birth. Without this data, New Hampshire would not be able to determine where parents are traveling from, removing the opportunity to create better access. Late entry into prenatal care is a red flag for poor birth outcome. The timely report of 2022 allows for early intervention to affect the entry into prenatal care. This is just one example of the negative consequences of the impact of Senate Bill 105 will have on health care in New Hampshire. And I urge you to vote no. I'm happy to answer your questions. And again, thank you for the opportunity to address the commission. And I would just like to add one other thought after hearing some of the testimony. Having filled that report out 3 times earlier in my life, I understand that it would be a little bit like, well, how many drinks did you have a day? But without that data, we never would have uncovered fetal alcohol syndrome. And over the last 25 to 30 years, we wouldn't have provided the counseling to patients of the importance of not drinking when they were pregnant. So I just wanted to clarify that.
Thank you. Representative Gerhard.
Thank you, Madam Chair. Just curious, I don't know if you can answer this, but can you be prosecuted for the answers you give to that questionnaire?
I have never heard of anyone being prosecuted for the answers that they gave to that questionnaire.
Thank you.
Thank you. Okay. Thank you very much.
You're very welcome.
Representative Schmidt.
Thank you, Madam Chair. So I apologize for speaking so much sharply to you, but that if you don't speak into the microphone, we can't hear you, and you're being recorded so that people who are watching and so forth. So I apologize for speaking so much sharply. But your testimony is very, very informative. And many of the things you referenced in your final remark are part of the person's medical record, are they not?
Yes.
Okay. In other words, that the scientific discoveries that were based on, you say on
Fetal alcohol syndrome?
Yeah, that's an example of it, yes. Some of the things that this form is very intrusive in asking, it would also be in the person's medical record separately, would it not?
Well, yes, it would be, but there would be no data collection from the person's private medical record. The data collection is from the birth report, the birth certificate report.
But I'm very concerned about the privacy aspect.
I understand.
So is there not a possibility that the form could be divided into things that are mandatory and it would serve the purpose you're talking about, but would not be intrusive in terms of some of the stuff that I might be, I'm sure it's helpful to the authorities to know, but you're asking people to basically lay their lives bare in many, many respects, and I have a concern about that.
I understand. I think that people from the department could probably answer that question with complete accuracy, but I understand that it's a national data collection system and all 50 states use the same collecting mechanism, but they really are the experts, not me, about that.
Thank you.
Thank you. Okay.
Thank you.
Thank you for your testimony. David Wieters from HHS. You just turned your microphone off. That's better. Thank you.
Thank you, Madam Chair and members of the committee. Thank you for having me here. My name is David Wieters. I'm the Information Services Director for Health and Human Services. And some of my testimony will make more sense after Director Tilly presents.
Then then we'll call you back later.
Great, thank you.
All right. Patricia Tilley.
Thank you. Good afternoon, Chair. Good afternoon, members of the committee. My name is Patricia Tilley. I am the Director of the Division of Public Health Services at the New Hampshire Department of Health and Human Services.
And good afternoon. My name is Ben Chan. I am the state epidemiologist at the New Hampshire Department of Health and Human Services and also a physician.
Thank you. I am going to try what Dave Wieters just did to get out of speaking in the future, but it was a great strategy. Thank you for the opportunity to provide additional information about Senate Bill 105 and the way that it would have unintended impacts on the residents of New Hampshire. Today, Dr. Chan and I are here to ask you to consider to either ITL the bill in front of you or modify it in such a way to further protect privacy and ensure that Granite Staters still can continue to easily access the level of public health, healthcare, and economic supports that they receive today. Specifically, Section 2 of the bill is unworkable. We are just a few of the many individuals here today deeply concerned that Section 2 may impact not only our funding, but the public health, healthcare delivery, and economic supports of real individuals in your communities. Notably, Sections 1 and 4 of the bill can work hand in hand with existing privacy and security governance and existing New Hampshire and federal statutes, including HIPAA standards. In particular, we are very comfortable with Section 1, which removes the penalties for the health questions. I've broken my golden rule of only providing short and sweet testimony today. You'll see that the written testimony in front of you is over 8 pages long. I am not going to read that. But the reason why the testimony is so dense is because the wide-reaching impacts of the bill. As we have researched and talked to partners, we continue to peel back the onion about the many ways SB 105 would weaken the foundation of services that individuals use every day, from access to care at a federally qualified health center to ensuring that your baby has the right screening services in the hospital to accessing child support and so much more. Importantly, the privacy of this sensitive data is already protected by existing state and federal statutes and the strong data governance systems that are in place both at the Secretary of State's office and the Department of Health and Human Services. Chapter Law 5C4 states that the Registrar of Vital Records shall consider the protection of the privacy of individuals about whom information is given. And to underscore Representative Rosenwald's testimony, no names are sent to CDC or the National Center of Health Statistics. Since 1907, the United States has used the data in birth certificates to ensure citizenship, proof of age, to prevent child labor, and to prevent fraud for entitlement programs and government benefits. In accordance with the Federal Public Health Service Act, all 50 states now ask a standard set of questions. This is to ensure interjurisdictional exchange. If I am a New Hampshire resident and I have my baby in Massachusetts, data can easily be exchanged and understood here in New Hampshire. If I am a Vermont resident and I have my baby here in New Hampshire, similarly, the birth record must be standardized. With your indulgence, I'm going to talk about just a little bit about the 4 areas that have significant financial and statutory implications of this bill. As an unintended consequence of Section 2, there are critical services at risk when we de-identify elements of birth certificate data. I'm also going to highlight the programmatic areas of the state that would be at risk for fraud, as Representative McDonald noted, because we may not have a complete data set to compare eligibility applications to or use for investigation. There are a number of other existing statutes that are in conflict with Senate Bill 105 that would need to be changed if Section 2 were enacted. And of course, there's money. The federal funds, both DHHS and the Secretary of State's office would lose for programs and data system modernization because New Hampshire would no longer have complete data. You can shrug your collective shoulders at less money for the state, oh well, or the sky is falling, but fewer federal funds means fewer basic supports like high quality health care, prenatal care in your communities for your constituents. These programs have real life consequences if New Hampshire does not have complete birth records. As Section 2 is written, it is unclear how data will be exchanged with the Social Security Administration. Currently, all infants automatically receive their Social Security number because states send birth records to the Social Security Administration. If enacted, it is possible that all 12,000 New Hampshire families a year who have babies would need to then bring hard copies of their birth certificate to facilitate the issuance of their Social Security number for their infant. This is going to be a significant hardship on families and the Social Security Administration. Federally qualified health centers. In order to receive federal support to provide low-cost care for almost 90,000 individuals in the state, FQHCs must be in federally designated medically underserved areas. There is a complex federal formula that uses local birth data to determine eligibility of where you can have an FQHC. Additionally, New Hampshire supplements their funding with federal maternal and child health funds, which are also based on local birth data. Without sub-state data, which would not be allowed if Section 2 went in as described, that money very well may go away. When the money stops flowing, access is reduced. Your constituents will not get the same prenatal care, primary care at places like Ammonoosuc Community Health Centers, COAS Family Health, Amoskeag Health, Lamprey Services. There are real-world consequences to this bureaucratic information. We've heard about the crucial need for local data, which needs residents in order to protect maternal health in communities that have lost their local labor and delivery services in their hospitals. Right now, there is a giant swath across the middle of our state, from Claremont across all the way over towards Rochester, where we no longer can have a baby. Simply subbing in the residence, the address of the hospital gives you no idea of the health status of that entire middle section of the state. Similarly, hundreds of families who receive voluntary home visiting services that provide support, parenting education to families, all of which have been known to reduce child abuse, no longer would be able to receive those services in your communities. If we can't describe the impact of the services at the community level, the discretional federal funding goes away, services vanish. Newborn screening, this is critically important. All 12,000 babies born every year receive timely screenings for conditions that, if not caught before there are symptoms, there are devastating negative health outcomes. Because this is so important, the department has a statutory responsibility, obligation to ensure that every baby that is born has access to that screening within 24 hours of birth. We use the birth record every single day to make sure no baby gets left behind. It isn't an overstatement that without this process, that is seamless and invisible to most of us, infant lives are truly at risk. Maternal mortality. With Section 2, the department is no longer going to have access to vital records data to verify the death certificate data, identify and assess the cause of death, and to support preventative programs and education as a result of these reviews. The infant birth data is required to appropriately link maternal deaths. We can't guess about this. As maternal mortality rises across this country, we can't afford to guess. With Section 2 of the bill, we will not have complete data to understand infant mortality, maternal mortality, prematurity, low birth weight, perinatal substance exposure, and so much more. When you, the legislator, asks us to tell them about any one of those issues or to evaluate the effectiveness of services, we would just have to say we don't know or kind of guess. The impacts of information related to the impact of losing labor and delivery is incredible. We won't be able to easily and accurately compare Medicaid data to the rest of the state and much more. Without the mother's residence or town or city, public health will not be able to release statistics by county or city. We won't know information for Manchester. We won't know information for Coos County. We won't know about information for the communities you serve. Without complete data, CDC has informed us that New Hampshire will be removed from all national data sets. We would not be able to compare New Hampshire outcomes with those from every other state. But this isn't just a public health problem. There are entitlement and regulatory functions and activities throughout the department that will not be able to be completed if the department does not have that complete data set. Director Karen Hebert, I'm going to do the same thing. I'm going to shove back to somebody else, is available to speak to this about what we would not be able to do in the Division of Economic Security without that record. Importantly, things like child support activities, Medicaid fraud prevention. The fully identified birth data is a backup to ensure that these systems work as intended and there is no fraud or abuse. Without access to names, DCYF is no longer able to independently verify parentage. DCYF uses this information for international adoptions, which is a requirement of the federal government. At the federal level, the census will have inaccurate population estimates for state, county, town, and local levels. New Hampshire residents of all age are going to be affected when programs like DCYF, Medicaid, child support cannot access timely and complete information. Potentially life-saving services may not be provided, and the state is at risk for fraud. Without going into detail, and I won't because my time is short, Section 2 directly impacts and conflicts with additional existing statutes in RSA 126 and 5C that all would need to be addressed. Section 2 would require a thorough review of existing statutes. And finally, there is the money. Our fiscal note, which you can read on your own time, describes in detail what federal grants would be in significant jeopardy without the ability to analyze complete birth data. It is estimated to be tens of millions of dollars that would not be available. We all agree that privacy is important. And Dave Wieters, I'll punt it back to him, is available to describe all the ways we guard and protect data, this most important and very private and very sensitive health information. DHHS is a HIPAA-covered entity and complies with all federal statutes to protect against the inappropriate disclosure of private information. Mr. Wieters can also describe the data governance and stewardship strategies that are currently in place to minimize the data elements that individuals may access while doing legitimate department functions. To answer a question earlier, can you just see the whole record? And the answer is no. If my job is to investigate one particular thing, I can see this much of the record. If my job, however, is to do the quality assurance on the entire birth record, as is our responsibility in statute, you will see more of the record. We have strict data governance that limits and is focused on data minimization, so you only see what you need to see to do your job. I'll end by suggesting that Section 1 of the bill and Section 4 of the bill both advance privacy. Section 1 is the section that takes away the criminal penalty for the health area. This is an area that we do not disagree with. There has never been a time in anyone's understanding where anyone was prosecuted for a criminal penalty for saying they were 125 pounds before they were pregnant and when they were actually 140. That has not happened. We're happy to put that in statute. Section 4 of the bill also further advances privacy and security by potentially limiting the amount of time that records are kept in a hospital. So I will sum up right now by saying Section 2 of the bill is unworkable for all of those many reasons. We are very concerned for both public health, the healthcare delivery system, and the economic supports of your families.
Thank you. Are there any questions? I think not. All right, thank you very much.
I have a question, Madam Chair. Is this going to a subcommittee? This is way too complicated to handle in one simple hearing. Is this going to go?
I haven't yet decided which one, but it probably should. I,
We need to hear from these people at greater length with regard to specifics.
yes, Representative Gould.
Thank you, Madam Chair, and thank you for taking my question. And I'm not sure you can answer it, and don't try if you can't. I'm trying to understand, this form gets filled out and it's sent to Vital Records, and then they disclose it to you and you hold it under HHS, under HIPAA rules.
Sure. So that's a great question. And, the Secretary of State's office, who is the owner of the vital records, can probably provide greater detail. But what happens is the hospitals or the birth attendant, if it doesn't occur in a hospital, completes the forms. The forms get uploaded and sent to vital records electronically. 5C then states that the records then go to DHHS because we have a tangible interest in the birth record. Of note, New Hampshire is the only state in the country that has vital records outside of the Department of Health. 49 other states keep this record within the Department of Health. However, we have a great relationship with Secretary of State. We have an incredibly detailed memorandum of understanding that describes how the data moves from point A to point B and how it is governed.
Thank you.
Thank you. Okay.
Thank you.
Yes, Representative Grassi.
Question?
Did you have a
Done? I look over, she's gone.
Very quick.
Yes, I mean, one of the things that really distresses me, I've worked on a number of grants over the years in Stratford County, and we have a very distinct division between Northern Stratford County and Southern Stratford County as far as health is concerned, and particularly as far as prenatal care is concerned. And one of the things you said is that what this is going to do is that in the future, if this is passed, and I'm looking at redistributing money within Stratford County to direct more aid to the northern part of Stratford County, which has more problems, that's going to be impossible for me to make that determination?
That would be true. So currently, as Section 2 is written, we would substitute in the hospital. So you would just know where babies were born.
Portsmouth.
Portsmouth. So we would have no information about Stratford County and the unique needs of Northern Stratford County versus the unique needs of Southern Stratford County.
Representative True.
Thank you, Madam Chair, and thank you for taking my question. So all this information that you're going to lose is because you don't have the name and address?
Yes. So the name, so there are two things, there are a number of complicating things here, but I'll answer the easy way first. Without the name and address, specifically the address, we don't know where those people are from. So in Senator Rosenwald's bill, it says the hospital. And this was a great example in Stratford County. Babies in Stratford County, Frisbee has just closed its labor and delivery services. We've got Wentworth Douglas and we've got Portsmouth. We don't know where those people would live. We would not know where those people live. So we would not know those that are at higher risk, who did not get adequate prenatal care. Some of the questions on that form sound incredibly intrusive. When was your last menstrual period? Ick, who wants to answer that? But the reason we answer that is that directly tells us what prematurity rates are. That's the reason for the question. What Section 1 of the bill does is take away the criminal penalties. We are all in agreement that there don't need to be criminal penalties for that portion. However, we do believe there need to be penalties about the facts of the birth, mom, dad, residence.
And can I just quickly, excuse me, can I just quickly add that, we obviously share the goal of protecting personal and health-related information, but it also remains important to have access to usable, actionable data. And that's one of the core tenets of public health data, and public health having access to this data is that we don't hold a data set just for the sake of having a data set. We use that data to promote health, to protect individuals' health. And that's done in a variety of ways, but it requires having that personal identifiable information. And so, Director Tilley highlighted many examples of how that data is used. Newborn screening, in order to identify babies that are newly born, to ensure that they undergo the necessary health screening, we use the birth record. To report on and intervene on issues around teen births, for example, we need that information in the birth record. And so the goals of protecting personal and health-related information, while also having access to usable, actionable information, are not mutually exclusive. And it becomes important not only for public health to have access to it, but also our local hospital, healthcare, and community partners for exactly the reasons that you're highlighting. Thanks.
Okay, thank you. Yes, Representative Gould.
Thank you, Madam Chair. So, my question has to do with, I had heard a rumor, and then something you said is making me feel the need to ask. This bill would do nothing to take vital records away from the Secretary of State and put them in Health and Human Services. Is that correct?
That is correct.
Thank you.
Okay. Anyone else? Representative Horrigan.
And you mentioned 10% of 10% of the babies that are born in New Hampshire hospitals are to mothers who live in other states, I assume, probably. And conversely, 10% of the mothers in New Hampshire are giving birth to babies in others outside New Hampshire, and I assume that's probably predominantly Vermont, Massachusetts, and Maine. So what data do those three states routinely correct? Is it similar to this?
Yes, so thank you for that question, Representative. There's a standard set of questions that all 50 states ask, and so that is the way that we can have interjurisdictional exchange. So again, I can have my baby in Massachusetts if I'm a New Hampshire resident, or a Vermont individual can come to New Hampshire and have their baby at Dartmouth or somewhere else. It's critically important that there is a standard. We work, the Secretary of State's office works closely with the National Center for Health Statistics to make sure that no matter where you're born in the U.S., you have the same level of information that's provided within the birth record.
Yeah.
Representative Gould, do you have a quick question?
It's very quick. Do the hospitals fill these out on paper and then somebody does data entry, or are they entered electronically?
It is primarily an electronic system now. I'm not probably the best to represent exactly what happens at the bedside in the hospital, but it is primarily an electronic system.
Thank you.
Okay, thank you. All right, thank you very much for your testimony. Janet Perkins Howland.
Good afternoon. I'm Janet Perkins Howland. I'm an OBGYN at Wentworth Douglas Hospital. I've had the great honor of working there for upwards of 25 years and delivering several thousand babies in the great state of New Hampshire. And I am not speaking for my hospital today. I also am a proud member of the New Hampshire State Medical Society, and I believe that my testimony is in agreement with their stance. As several people have mentioned, for Section 1, I am in favor of the idea of removing criminal penalties for these type of things. I'm always in favor of removing criminal penalties for people who give birth, and that is in the context of supporting people. I think we're all want to support women or people who give birth in our state. Section 2, I think, is the problematic part. The intent may be good, but the impact is definitely not. I think that it is absolutely possible to believe in the principles of privacy and autonomy, reproductive freedom, HIPAA compliance, all these things that have been mentioned, and also be in stark opposition to Section 2 of this bill. I just want to highlight the importance of communication, and the communication that is bidirectional. The safety of our patients is deeply important to me, and hopefully to everybody in this room. But there is a relationship between the patient and the care providers, everybody that is on the staff at the hospital or providing care to the people who give birth, and also for the community. So this information that we're getting is not just interesting, but also impactful. And it's impactful in both a retrospective way and a proactive way. I've had the honor of being on the Maternal Mortality Review Board in New Hampshire, and we go in great detail off the data that we receive from the birth certificates about what is related to somebody's birth. And I think it is, you might be surprised at how the relationship between some of these health things like smoking or IVF or anything is actually related. Substance use disorder is related to the outcomes, the poor outcomes. Just a brief example is the New Hampshire PRAMS, which is the New Hampshire Pregnancy Risk Assessment Monitoring System. It's funded by the CDC. And this is information that we can't get from billing data. This is information that is taken from random sampling of the birth certificates, and it gives us information about maternal mental health, preconceptual health as well, but maternal mental health. And so I'm deeply concerned about the taking away something like PRAMS, because this is where we get our data about something like postpartum depression. And I think I probably don't have to tell people in this room about what the impacts of postpartum depression is. So I think the Section 2 of this bill is incredibly problematic in terms of preventing us from improving outcomes and informing quality and safety programs at our hospital and across our state. It's harmful. So thank you very much.
Okay. Questions? Seeing none, thank you for your testimony. Kristen Keniston.
Thank you, Madam Chair and honorable members of the committee. So I'm Kristen Keniston. I am the new state registrar for Vital Records. This is day 3 for me, so I get to come in and chat with everybody. Just to put you at ease, I was the city clerk in Lebanon for 3 years, and prior to that, for the prior 12 years, I was in that office for staff. So I have 15 years of Vital Records experience before coming into this position. Joining me today is Tricia Pietsu. She was the acting registrar for Vital Records and is also the director of the elections office. And she also brings to the table 25 years of city clerk's experience dealing with Vital Records. And we also have David Scanlon here with the secretary, who is the Secretary of State. So our office is not taking a position on this legislation. We do believe this is a policy decision for you to make, but we want to bring to your attention some of the unintended consequences that this could have, not only for the Division of Vital Records, but also for the constituents in the state of New Hampshire who are going to have children. So just starting on the first section, I think you've already heard enough testimony regarding the felony provisions. We don't have anything to offer on that. It doesn't affect the birth certificate, nor does it affect the Social Security side of things, so we're not going to offer any suggestions there. Section 2, which as you can see is having the most focus. If you look at what's being proposed, it's striking the child's name and the parents' names and their information. That is the information that is used to create the actual birth certificate. So by striking that information from that worksheet, we can now no longer create birth certificates. And that's could be problematic to our constituents. So currently what happens is that paperwork is filled out at the hospital. And if I'm remembering correctly, 19 years ago, I did the green sheet when I had my daughter, and then the hospital staff worked with me on the rest of it. If you look at it, there are a lot of boxes that say unknown. And so that tells me that you don't necessarily have to provide that information. That form, once it's completed, is taken to the birth registrars at the hospital, and then they key it into a system known as Nevrin. The Nevrin database is what houses all of our vital records and the vital record statistics. That is when the parents go to the clerk's office to obtain a certified copy of that birth record. That's the database that they're accessing to create that record. So what's happening now is when the registrar creates the record, they issue something that's called a parent notice, which does two things. That sends the parent notice to the parent who's on file so that they can get a preview of the birth certificate, make sure there's no spelling errors because that does happen. It also tells them that that birth record's available and they can go and purchase a copy of it. And because of the way our system works, up to as far back as 1935 is available anywhere in the state of New Hampshire. So if I had a complication and I had to go an hour away to a hospital, I might not necessarily want to go back to that clerk's office to use or to obtain my certified copy. So I could go right down to my own clerk's office and obtain it. But what's going to happen now is when they key on the information at the hospital, because they still have to account for this other information that's requiring to be captured, the child's name is now going to be entered as baby boy or baby girl. The last name will be put in as unknown. The parents will all going to be either unknown or not stated. So the only identifiable part that's going to show up in that Nevern database for your local clerk to pull up is going to be the date of birth, the time of birth, and the location, which, as you can tell, there's nothing to identify that that's even the correct record for the people that are requesting it. That's also going to require that the parents go to the clerk's office where the event occurred to make any revisions. So that's where they're going to go and assign a name to their child. That's where they're going to go and have to prove that they are the parents of that child for the record. Which brings us to another tricky point where, first of all, how does the clerk even identify that they have the correct child's record before they start just making amendments to it? And second of all, how do you know the person in front of you is the correct person that should have access to that record, because they might have given me photo identification, but what can I match that to? So that's something that needs to be thought of. The cost for amendments too. So the amendment process itself can actually be, if it's within the first 14 days of it being filed, it's relatively simple. But once you get past that 14 days up to 6 months, it's a $10 fee. So now we're incurring a cost to the constituents. And they have to come up with, they might have to come up with some proofs in this, generally not, but they would still have to go in, fill out the form, present their photo IDs. It's going to create something called a marginal note on that record. And that marginal note stays on the record forever. And it just shows that all these amendments had to be made to the record because everything previously said unknown or not stated. After you hit the 6-month mark, it becomes much more complicated because people have to provide proofs of what the corrections are to be made. And every correction that they're making, so the parents' names, the child's names, places of birth, is going to require 2 pieces of proof to prove that that's what the information should actually be. So it does become quite a process for the parents if they're not able to get directly in there. So if there was a complication that prevented them from showing up, they might not go in until that 6-month mark, and then they're going to have all of those corrections to have to make. And the did I miss anything else on that section? Oh yeah, so again, the correction procedure is the local clerk where the event occurred. So there's only so many clerks in the state where we have birthing centers, really. So they would have to go there, which is going to be an influx on the local municipal resources that it takes a while. It can take up to about 10 to 20 minutes, depending on how complicated the correction can be. So then the other thing that we were looking at was Social Security Administration. So because DHHS has already touched on this, I won't go too much into it, but now we do not have this information to supply to Social Security. So now the parents are going to have to go in, get their record amended, purchase the certified copy, and then do it the manual way to get their Social Security cards issued for their children, either by mailing it in or showing up in person to do this at the Social Security offices. Right now, you just check a box, and if you say, yes, I want it to go, the parents are going to get that Social Security card in the mail within a few weeks, usually a month. So that is now creating that hardship for the parents. In 2022, just so you know, we had over 12,000 children that were born. Of those over 12,000 people, only 52 didn't request a a social security number for their child. And that could be because they didn't agree on a name. So they did just name their child baby boy or baby girl, or something happened with the filing that prevented them from doing the social security number. Let's see. And it'll also cause some confusion for the parents as well. So if you have people that have had previous children before, now all of a sudden they're not getting their social security cards in the mail, they're not getting that parent notice, they're expecting that now. So now they won't be having that. Is there anything else you can think of to add on that section? Nope. Okay. So then the third and final section that we just wanted to touch on was the records retention for maintaining those birth worksheets. So the worksheets are actually maintained by the hospital. We don't get them at all. And so right now it's to maintain them permanently at the hospital. We don't have any concerns that these aren't being kept permanently. Our recommendation though is to at least ask them to keep them for 7 years. And our reason for that is because there is something in their state called a delayed birth. We're actually dealing with quite a few of them right now. So if a child is born in a hospital and it's been more than a year and we find out, oh no, the child's information was never input into Nevrin, they have to file a delayed birth. They have to come up with proofs of this child actually being born. It's 4 proofs. And one of the proofs that's obviously a very good proof to have is this document right here. So that's why we're just maintaining, we recommend 7 to maintain, because most people, if they don't get their birth records right off, they do it when they register their children for school. So 7 years seem to be a decent amount of time. As far as any costs, is for the legislation, it's kind of minimum on our department. The bill doesn't appropriate any funds for the implementation, nor are these costs included in the budget passed by the House. There would be a one-time cost approximately of $100,000 for system changes that would be needed within the Nevrin system. And then with various contracts and agreements with entities such as the CDC and the Social Security, we receive roughly $160,000 a year for reporting that information. The CDC uses the birth data each state provides to analyze trends nationwide. All states provide this information. These funds are used to support the operations of our divisions and would need to be replaced with the general funds. So there might be a position, say, that's partially funded or fully funded by these funds that are coming in, and that person is still going to stay on with the division. Now we have to come up with the funds to keep them on. So that is the end of my testimony. Does anyone have any questions?
Yes, Representative Schmidt. I was talking to other people.
So it seems like we're going to have a subcommittee, so I hope you'll be available for the subcommittee. What happens with people who have home births or use doulas in some kind of a non-hospital situation? All these records and all this data has to be obtained. And how does that happen?
So that does not appear to be affected at all by this bill, but it's essentially the same way. The midwives are given the exact same worksheets, and then that information is used by our department to key the record on to the system, because there isn't a birth registrar to do that.
Did I cover that? Representative Gould?
Thank you, Madam Chair, and thank you for taking my question. You mentioned keeping the green form for 7 years if the parents don't request the birth certificate at the time the child is born. Is that correct?
Well, just to clarify, I'm recommending that the hospitals still have to keep them so that there is a backup just in case they are not aware that the record wasn't filed. They might not become aware until they go to get the copy to register the children for school. So the 7 years was that kind of window where we thought.
Yep. So
good
they,
idea.
meaning the parents, might not be aware.
Yeah.
So my question is, if the hospital doesn't keep the green form and the parents did not ask for the birth certificate, the data no longer exists, it didn't get entered into the system?
We would then have to file something called a delayed birth, which is a completely different process. And no, the data never enters the Nevrin system at that point. It's a manual process that we have to go through at the local clerk's level and then with us.
Okay, so I'm a genealogist too, so
Okay.
I understand all the delayed stuff. So the issue is the hospital fills out the form, but if the parent doesn't want the birth certificate at the time of birth, then the information, the data from the sheet never gets entered into the data
No, it's not
system.
that the parent doesn't want it, it's that an error occurred.
Oh.
So that they might have just made an error and thought they keyed it into the system and
Okay,
didn't.
I got you.
Yeah.
Thank you.
Yes. Okay. Yes, Representative True.
Thank you, Madam Chair. When I was born, they just chiseled the thing right into the concrete. Who issues the birth certificate in New Hampshire?
So it comes out of the Neverin system. It can either be issued by my department, the Division of Vital Records, or it can be issued from your local clerk, city clerk or town clerk.
Follow up.
Thank you, Madam Chair. So, if the information from the green sheet is forwarded to your office without the name and address, you can't do the birth certificate.
So what it is, it's the birth registrar at the hospital. They won't have that data to enter it into the database that we then can retrieve the record with.
Thank you. Thank
Yes,
you.
you're welcome.
Thank you for your testimony. This will be going to subcommittee, Representative Grotus subcommittee, and I trust that the HHS and Vital Records will work with us as we meet. And I'm going to only ask the individuals who have signed up to speak to testify. Rather, not any more from the agency, because I think we've gotten a flood of data from them. So, Kaylee Crockett.
Good morning, Madam Chair and committee members. My name is Kaylee Crockett,
And I'm David Boone.
and we are here today to tell you about our unique experiences that our family has had with the newborn screener. So
But please, you'll have to get closer to the microphone and speak a little louder.
I apologize. We're here to tell you about our family's unique experiences with the newborn screener. On October 21st, 2021, we received a phone call that our 8-day-old son, Nolan, had been flagged for a genetic condition that could be potentially fatal. We were told that the condition was called MPS 1, which was short for mucopolysaccharidosis type 1, a genetic condition that is so rare that most physicians do not know about it. And in our state, we do not even have a doctor that treats it. Nolan was born into an incredibly unique situation. His form of MPS 1 affects 1 in 500,000 births and is known as Shea syndrome. The mutation that makes up his condition has only been documented once before, and that person was not diagnosed until she was in her 20s. He is the only person in the world to ever be diagnosed with his form of MPS 1 prior to the onset of symptoms, and therefore prior to needing any sort of treatment. Additionally, not only is he the only person to be identified with MPS 1 in New Hampshire by the newborn screener, he is also the only person to even be flagged as potentially having it in our state. When we received the call in October of 2021, we had been told that we needed to get our child to Boston Children's Hospital for further testing the next morning. They had already set up our appointment for us. We just needed to go down and see what our next steps would be. After completing several confirmatory tests, it was determined that our son did in fact have the least severe form of MPS 1. Where Nolan has such a mild form of the condition, he doesn't have any visible signs, nor does he have any symptoms of the condition currently. Nolan has 6% of his enzyme level working. This has allowed him to break down enough of the complex sugar chains and clear his body of the waste, thus allowing him to not need any treatments currently. Eventually, his body will not be able to keep up and his marginal enzyme level will stop working, causing him to need weekly treatments for the duration of his lifetime. Since Nolan was identified to have MPS via the newborn screener, we are very fortunate to bring him to Boston several times a year to have his levels tested so that they can monitor when he will need to begin his treatment. The goal is to have him begin treatment when his enzyme level falls to a level that is not producing enough, that he is not producing enough, but is not yet harmful to him. Had Nolan not been identified on the newborn screener, he would have spent years in and out of different specialists trying to determine the reasoning behind an array of symptoms the buildup of waste would have caused him. By the time that a diagnosis was made, the damage already would have been done, and unfortunately, there is nothing that they can do to reverse it at that point. They can just treat it from becoming worse. Across the country, MPS 1 is not something that is universally tested for on the newborn screener. The MPS community is quite small, and we often hear of children that are not identified as having the condition until they have already started developing irreversible symptoms. Taking identifiable information off the newborn screener will make it that much more difficult to track families and inform them in instances where their child could have potentially fatal genetic conditions. At 8 days old, Nolan's life was forever changed in being flagged by this condition. And we are forever grateful that we received this call and are able to provide him the necessary treatments. It is our hope that you consider not making any changes to how information is shared with the newborn screener so that more families like ours are able to provide their children with the best possible outcomes in the timeliest of manners. Thank you for your time.
Thank you for your testimony. Are there any questions? Seeing none? Very good. Thank you.
Thank you.
Jennifer Smith? Okay. Lucy Hodder? Okay. She gave us her testimony. Thank you. We'll take that in lieu of a speech. Dee Dustin?
Madam Chair,
Yeah.
one moment. We did not receive enough copies from Lucy Hodder. I'll tell
We will get more.
the committee members on this side that need to access.
We will make sure we get more copies.
Hi, good afternoon. For the record, my name is Deo Dene Dustin Badarai. I am a little intimidated surrounded by all the experts. I am also just speaking as a parent of a child with a disability. I was born and raised in Kentucky. I now own a home and live in Concord. We're raising our 2 children there. I'm asking you to oppose this bill. I want to address one program that will be adversely affected by Section 2, and that is the newborn screening program. Our 8-year-old son has spinal muscular atrophy, SMA. This is a degenerative neuromuscular disorder that causes his muscles to be very weak, and he navigates the world using a wheelchair. He's an amazing kid. Our son's diagnosis was delayed for months because when he was born, New Hampshire was not screening for SMA in its newborn screening. And so onset of symptoms occurred. Had he been born in Massachusetts where they were screening for SMA, he could have been identified and treated right away. And he likely, like other children who are screened and treated before symptom onset, would not be using a wheelchair today. However, after my son was finally diagnosed after his first birthday, I began a years-long effort to have SMA added to the newborn screening panel here in New Hampshire. And I can happily say that it has been, and that every baby born in New Hampshire for the last couple years is screened for SMA, is quickly, within a matter of days, given confirmatory diagnostics and enrolled in treatment. Those who, so if you pass this bill, the department will no longer be able to match the newborn screening data daily with the vital records necessary so that this time-sensitive follow-up can continue to occur. And this bill, in that way, undermines the critical mission of the newborn screening program. For example, so it would cause families to wait for results, and then that wait could have dire consequences. And for example, children who receive treatment for SMA prior to symptom onset are walking, running, and playing with their friends. Children like mine navigate the world with a wheelchair, but that is the least of the medical interventions that he will be going through in his lifetime. The difference between timely diagnosis through newborn screening and our very successful program here and the lack of this notification cannot be overstated. Please do not pass this bill as written. It's a solution in want of a problem when it comes to newborn screening program, which will be affected. The newborn screening program works, and parents who have concerns around privacy regarding the newborn screening program can opt out. It's not a mandatory program. But please don't undermine the effectiveness of such an amazing life-saving program for the majority of Granite State families who rely on it. I'm happy to answer any questions regarding that small aspect of this bill.
Thank you very much. I don't see any questions, so thank you for your testimony. Representative Murphy?
Thank you, Madam Chair, members of the committee. Excuse me. For the record, my name is Nancy Murphy. I represent Hillsborough 12, which is the town of Merrimack. I know a lot has been said already, so I'll skip comments about most things, but I just wanted to voice a concern with Section 2 of this, and with a little different take. Public health agencies and researchers will not be able to assess geographic patterns of birth outcomes or pregnancy complications because putting the hospital in place of a home address, as suggested in that part of the bill, is inaccurate. This will be especially problematic for both high-risk pregnancies and deliveries among rural residents, but also the problem is specific to my community. Public health agencies or researchers will be unable to assess clusters of birth defects or other health impacts, things like birth weight or preeclampsia on newborns, because we will not have town of residence or maternal age. Age is necessary for all analysis of this kind because newborn health problems are strongly tied to maternal age. In Merrimack, we have a PFAS exposure and contamination problem, and one of the known associated health outcomes is low birth weight in newborns. Without the ability to assess whether in a hospital, we may know that these children are being born with low birth weight, but we won't be able to tie them to Merrimack. Essentially, this would give a free pass to a polluter like Saint-Gobain and other polluters because the de-identification of birth data will make those analyses impossible. So it's just another thought, another perspective on how this will potentially impact not only a PFAS situation, but other environmental impacts that DHHS may wish to monitor, and they'll be thwarted in that process. So that's all. Thank you.
Thank you for your testimony. Okay, Heidi and Sam Caswell.
Good afternoon, Madam Chair McGuire and members of the committee. My name's Heidi Caswell, and I reside in Bedford, New Hampshire. I'm here with my son, Sam Caswell, today. And I'm here to testify against Senate Bill 105 and the enormous impact it will have on the timeliness of notifying providers of out-of-range results for babies born with life-threatening diseases. Diagnosis via newborn screening offers the earliest treatment for a number of diseases, some in which a delay of only a few days can be the difference between life and death. In many cases, later treatment will limit optimal results that could have otherwise slowed or even stopped progression of a deadly disease. I had a small part in advocating for MPS 1 to be added to the newborn screening. My son and I both spoke at the newborn screening meeting the night that MPS 1, XALD, and Pompe disease were being voted on to be added, and we were thrilled when they were. I was and continue to be invested on a very personal level. You see, my son Sam was born with MPS 1 Hurler syndrome, the most severe type of MPS 1, and I had to fight long and hard for a diagnosis. I don't want any other parent to have to wait for answers like I did when early diagnosis is right at our fingertips today. back in 1997, when Sam was diagnosed, there weren't any doctors that seemed to know what MPS was, and still there are very few today that do. I think they study it for 10 minutes in medical school, so they don't see the signs. And newborn screening didn't exist for Sam's disease and so many others back when he was born. And a lot of hard work has gone into making this a reality. By not providing the infant's name, I believe the bill will send us into a tailspin backwards. After all the progress that's been made to identify serious medical conditions at birth that were previously so difficult to diagnose. MPS 1, like many other diseases on the panel, progresses quickly, but there are often not physical signs until it is too late for the healthiest outcome, both physically and cognitively. The damage that has taken place prior to treatment is irreversible, which is why it is imperative the diagnosis be made as shortly after birth as possible. Newborn screening saves lives by giving babies born with life-threatening conditions early treatment that can slow down or even stop the progression of an otherwise deadly disease. Parents have hope where there was none before. They get to see their children grow up. I'm so thankful to have my son Sam sitting next to me today, because I very easily could have lost him, like so many of my MPS friends have lost their children. My hope is that the Department of Vital Records and the Department of Health and Human Services can work together to revise the worksheet to accommodate the privacy factor while not negatively impacting the records and surveillance of newborn screening. I'll close by reiterating the statement I believe encompasses the essence of this bill. The timeliness of out-of-range results on the newborn screening panel will be greatly impacted, which will interfere with the purpose of the test, which was to identify and treat diseases that would have progressed or even worse, resulted in unnecessary death. Newborn screening does save lives. As I was ready to leave the house this morning, I had a notification and I went onto my Facebook page, and it was kind of surreal that this post came up. And this is a friend of mine who lives in Michigan who's lost 2 children to MPS 1. Her post read, "Happy birthday in heaven, Matthew. Today it's hard to believe you are 37 years old. On my way to work this morning, I wished you a happy birthday, and then I said, I know you were with your sister." His sister also died of MPS 1. "I only got to spend 3 birthdays with you, but in my heart, you were never forgotten. Love you, my dear son, until I see you again. Happy birthday." No parent should have to be wishing their children a happy birthday in heaven when they can be diagnosed through newborn screening. Obviously, it didn't exist back then, but it does now, so I think we really have to take it seriously. Thank you for your time.
Okay, thank you very much.
Thank you.
All right.
All right. Dear Chair McGuire and members of the committee, my name is Sam Caswell, and I'd like to thank you for letting me share a few words today about why newborn screening is important to me. If newborn screening had been available for my disease when I was born, I would have been diagnosed within days after birth, and my life would be very different. I feel extremely lucky and thankful to be here, but sadly, a number of MPS friends I have met over the years are not. When you have MPS 1, there is a deficiency of a particular enzyme, or in most cases, you are completely missing the enzyme, which is necessary in order for the body to break down and recycle materials and cells. Without it, waste materials store in every organ and tissue, causing death without early treatment. The reason early diagnosis is so important is because the damage taking place to organs every day can never be reversed. Treatment will prevent further organ damage, but you can never get rid of what is already accumulated. Now that MPS 1 is on a newborn screening panel, the lack of enzyme activity is flagged, and the baby is able to be tested for MPS 1 and get immediate treatment. I was so excited when my disease was added to the panel because I figured these babies wouldn't have to go through a lot of what I have. I didn't get treatment to give me the enzyme for a year, which was the case with a lot of my friends with MPS, and the damage to the cells and major organs during that time causes a lifetime of damage. My lungs and heart valves have been greatly affected, and a number of my friends with MPS have died from these issues. I was mainstreamed through school, but the work didn't come to me as easily as it did for my peers, and a lot of the kids I know were in life skills programs because of getting treatment later. Being detected through newborn screening and getting early treatment improves quality of life in every way. It slows down the progression of the disease and prevents permanent tissue and organ damage. If I had been able to get the enzyme shortly after birth, I would be leading a very different and much more independent life than I am. I really hope the babies of the future with MPS continue to have opportunities I haven't by being diagnosed for newborn screening. Thank you for your time.
Thank you for your testimony, Mr. Caswell.
Are there any questions?
I don't see any. Thank
Thank
you.
you.
I'm going to ask the lobbyists, then the agencies, to support the subcommittee as necessary. This is getting a bit repetitive, and I think the subcommittee can work out some of the details. Is there any member of the public that wishes to speak on Senate Bill 105? And is there anyone in support of Senate Bill 105? Please, we will be delighted to take your written testimony at any time. All right, in that case, I'm going to close this public hearing. The subcommittee will, this bill will go to Representative Grota's subcommittee, and we will be working on it.
Madam Chair.
Yes.
Yes, I think you'll agree with me. I'd like to thank all of the families who came and gave their personal stories today. Thank you very much for taking the time to come before us.
Yes.
Madam Chair,
Yes.
I'd like to also thank all of the various bureaus and agencies, because the complexity between Vital Records, DHHS, the way this process happens, it was really important for us to hear
Yes.
how complex. People who thought this was going to be simple were very mistaken. Thank you.
Well said, Representative Gould. All right, we are going to take a break, and I'd like the Republicans to come back as soon as possible so we can have a brief caucus prior to our executive session. You'll need to get copies of that. Okay. Okay, welcome back, everybody. We hope everyone had a chance to calm down and eat something. All right, so we are in executive session, and Senate Bill 108 that we heard this morning is going to be added to the list. Yes, that's the public defenders. Okay. So I'm going to start with the bills that I know have committee reports already written. So Representative Schuett, you have a motion on Senate Bill 147.
Diane,
Da-
microphone, Diane.
I move that we adopt Amendment 1493.
Right. I'll second that.
Is there, okay. I was going to say, is no one going to second that?
Is that 14?
Amendment 1493, 1493.
All right. If you can talk about that while you're while we're all leafing through our papers to find it.
Yeah, everyone should have a copy. I passed it out just before we broke.
Okay.
And it basically amends the Senate amended version to strike out what the Senate had originally put in, which is addressing.
You're not projecting properly.
Maybe I'm. Sorry, I moved it back because I was pawing through my papers. The major difference is under on page 2 of the bill, if you're looking at the bill, under H, and I'm sorry, I am looking at the amendment. Looking at the amendment on page 2, line 20 through 22, we struck the Senate amendment originally took that entire exemption out, but we reinstated it to say that the board can exempt the dentist, one specific dentist, from the above requirement if they are board eligible or board certified in either dental anesthesiology or oral and maxillofacial surgery. We heard in the subcommittee and subsequently that this was something that the board was seeking to do.
Yes.
And the rest of the amendment is basically just allowing the board to institute rules to facilitate the changes that were brought in the Senate amended version of the bill.
Yes, and the audit of the dental board identified that they should have a subcommittee on anesthesiologists to provide technical expertise, and so that's what the bill does and the amendment. And they also took umbrage with the idea that all board certified dentists would be exempt from the requirement of having a second person there. So this only allows them to exempt specific people or specific circumstances. And I'm okay with allowing the board to have the authority to do that. And they're already working on rules that would implement it.
And the other important part in the bill that came from the Senate was to permit dental facilities, because that had not been addressed previously in the statutes.
And yeah, it came up at caucus, and I'd like to reiterate that it's very different from the facility licensing for massage parlors, because the dental board already inspects dental offices and facilities for suitability for anesthesia. What this does is it allows them to give the license for the facility at one time, and they don't have to repeat the application and the inspection every time personnel changes. So it's simpler. Are there any other comments or questions? Okay. Not seeing any, the motion is to adopt Amendment 1493, and the clerk can call the roll.
Representative Simon?
Yes.
Representative Lekis?
Yes.
Representative Bailey?
Yes.
Representative Santonastaso?
Yes.
Representative True?
Yes.
Representative Dolan?
Yes.
Representative Abar?
Yes.
Representative Gerhardt?
Yes.
The clerk votes yes. Representative Schmidt?
Yes.
Representative Goley?
Yes.
Representative Schuett?
Yes.
Representative Horrigan?
Yes.
Representative Grassi?
Yes.
Representative Davis?
Yes.
Representative Fitzpatrick?
Yes.
Representative Gould?
Yes.
Representative Smith?
Yes.
And the chair.
Yes.
The vote is 19 to 0.
Okay. Representative Schuett?
I'll move ought to pass with the amendment on Senate Bill 147.
I'll second. All right. Do you wish to discuss?
I don't think there's too much more to be said about the bill. We've pretty much discussed the whole thing.
What she said. Anyone wish to make a comment, question? All right, seeing none. In that case, the motion is ought to pass with amendment on Senate Bill 147. The clerk can call the roll.
Okay, Representative Simon?
Yes.
Representative Lekis?
Yes.
Representative Bailey?
Yes.
Representative Santonastaso?
Yes.
Representative True?
Yes.
Representative Dolan?
Yes.
Representative Abar?
Yes.
Representative Gerhardt?
Yes.
The clerk votes yes. Representative Schmidt?
Yes.
Representative Goley?
Yes.
Representative Schuett?
Yes.
Representative O'Brien?
Oh,
Oh, no,
Representative
no, I'm
Horrigan
sorry.
votes yes.
Horrigan.
I vote
Horrigan.
yes.
Sorry. Representative Davis?
Yes.
Representative Fitzpatrick?
Yes.
Representative Gould?
Yes.
And Representative Smith?
Yes.
And the chair.
Yes.
You forgot me.
Is there
Grassi.
someone forgotten?
Who did I
Oh,
forget? Oh,
Representative
Grassi. I am so sorry. No, another demerit. What did you vote? Yeah. Okay. It's 19 to 0.
All right,
And
the motion passes
yeah.
19 to 0. Is there any objection to consent? All right, seeing none, we'll put that one on consent. Okay, and the next one is 203, is it? Senate Bill 203, yes. Representative Schuett, you want to move, make a motion? I can't find that.
Did you have an amendment? What's the number?
So I believe we are looking at Amendment 1365.
So you're moving the amendment?
And this was adopted by the subcommittee in a 3-0 vote. And basically, it negates the rest of the bill because the inclination, when we heard from the Commerce Committee, which normally would hear this bill.
Representative Schuett, do we have that amendment?
Pardon me?
Do we have that amendment? I can't find it.
We
It looks
should
like everybody's
have.
shuffling.
I believe that she submitted this.
It was days ago. Yeah.
At the last time we got together.
Yeah.
Which, let me see if I
So
can.
it's somewhere in your files. And somewhere in my files, which I can't find either. Yeah.
I can almost read it to you. It's only like 2 sentences.
Why don't you do that while we're all shuffling papers here? Okay, please do read it, Representative
All
Schuett.
right. Amend the bill by replacing all after the enacting clause with the following. Office of Professional Licensure and Certification, Board of Manufactured Housing website. If the board, excuse me, if the Board of Manufactured Housing under RSA 205A:25 through:31 is repealed, then the Office of Professional Licensure and Certification shall maintain the Board of Manufactured Housing website for the board for a minimum of 5 years from the effective date of this act, which is 60 days after passage. That's because the board is actually abolished in House Bill 2. And if that goes through, we are, what's the word I want to use, expecting that there's likely going to be some sort of reiteration of a board to deal with the issues that, as we heard, are very prevalent. And this would allow that board to be referenced through the OPLC website at some point, if it happens in 5 years. If it doesn't happen that soon, then they probably don't need one.
Yeah, the testimony at the hearing convinced me that we did not want to maintain the board and change it in the way the bill wanted. But it does serve a useful purpose. We aren't really the right people to figure out how to get a quasi-judicial complaint board set up. But we can at least save the history and the records so that whenever whatever method is chosen to deal with the issue, they won't lose the history. I thought that would be important. And the OPLC says it doesn't cost anything, so. Okay. Any further, Representative True?
And I'm still shuffling. So the website that is maintained is the OPLC?
For some reason, because its title is board, and nobody else wanted it, the Manufactured Housing Board, which is a quasi-judicial board to resolve issues in manufactured housing parks, is housed within the OPLC. And their website is on the OPLC website. There's a link to it. So they'll keep it. That is Senate Bill 203, Amendment 1365.
And do we have any idea what the Senate's going to do in response? I mean, we may not care, but
The thing of it is that the House position is that board goes away.
Okay.
So, so,
it's in HB2. All right, good enough.
so if it's going away, we certainly don't want to reinstate it and
Yeah.
reformulate it.
Yeah.
And we don't know what the Senate's going to do because it's in House Bill 2, which they haven't yet produced.
They're still thinking about it. But in any event, we don't want to lose the history.
I get
And
it.
that's what all this amendment
fine.
does. It keeps the history. Any other questions? Okay, not seeing any. The motion is to adopt Amendment 1365, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
Yes.
Representative Santonastazo.
Yes.
Representative True.
Yes.
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhardt.
Yes.
The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
19-0, the amendment passes.
All right. I move ought to pass with amendment for Senate Bill 203.
I'll second.
Seconds all over. 'Cause I think Gould was first, yes. And I'll just say that we've covered everything, I think. And Representative Gould, do you have a comment?
I'll say the same, and certainly the ROC community members are, I think, are going to be very happy with this.
Okay, well, we hope so. That's,
They won't be very happy with anything.
well, it's, yeah, well, yes. We're not going to impose that particular board on them. Any other comments? Okay, the motion is ought to pass with amendment on Senate Bill 203. And the clerk can call the roll.
Okay, Representative Simon,
Yes.
Representative Lucas.
Yes.
Representative Bailey,
Yes.
Representative Santonastazo,
Yes.
Representative True,
Yes.
Representative Dolan,
Yes.
Representative Abar,
Yes.
Representative Gerhardt.
Yes.
The clerk votes yes. Representative Schmidt,
Yes.
Representative Goley,
Yes.
Representative Schuett,
Yes.
Representative Horrigan,
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
Okay, 19-0.
All right, any objections to consent? Seeing none, we'll put that one on consent also. Okay, so is there anyone else who has a pre-written committee report that we can deal with? Seeing none, we'll go on to more of the easy ones. Senate Bill 108, which we heard this morning. Does anyone have a motion? We said we'd try and exec it this afternoon. All right, Representative Gould moves ought to pass, and second by Representative Simon.
Patrick.
Oh, excuse me, Patrick. I could tell which direction it was coming.
But I'll let him have it.
Okay, Representative Gould, do you wish to speak to your motion?
Well, obviously, I was very moved by the testimony this morning because of their work with juvenile justice defenders. But seriously, I think that this is an important means to help them retain and recruit good quality public defenders, the service they provide to our state. 80%, I was shocked at that number, of the cases in New Hampshire they represent, and they just do a fantastic job. And so I'm very supportive of this.
All right, Representative Fitzpatrick?
Representative Gould summed it up just fine. Thank you,
All
Madam
right,
Chair.
thank you. Representative Blackus?
Yeah, just briefly. I mean, I expressed concerns about the cost, but that was based on a incorrect assumption that they weren't getting subsidized health care now, and this would be adding it, which could be a significant expense. But apparently they're getting it now. This will just be a different program, and it will be minor changes. So I'm okay with it.
Okay. Yes, they give us some data to show the insurance, convince us that it was a better deal. Okay. Anyone else have a comment, question? Okay, in that case, the motion is ought to pass on Senate Bill 108, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lucas.
Yes.
Representative Bailey.
Yes.
Representative Santonastazo.
Yes.
Representative True.
Yes.
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhardt.
Yes.
The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
19-0, the bill passes.
All right. Any objections to consent? Okay, Representative Gould, we're going to want that committee report before you leave today. Okay. And Senate Bill 53. The subcommittee has met, has agreed, but they don't want us to pass the bill or to act on the bill until after the Building Code Review Board has met. So we will pick that up on our next scheduled executive session, which is Wednesday, the 24th, I think, or 25th of May. Wednesday. The 24th, okay, May 20th.
Yes, it is.
Okay, May 24th, we are going to have an executive session for anything that's still in subcommittee or that we don't finish today, and especially including Senate Bill 53. No, today was the last hearing. If I'd Okay. All right. Moving on to Senate Bill 49, which is the only bill we have to vote on today. Representative Goldie, I believe you have a motion.
Thank you, Madam Chair. I have an amendment to offer on Senate Bill 49.
Your amendment is?
1476H that I handed out just prior to the exec session.
All right.
Which could be anywhere.
And I know everybody has a stack of papers in front of them, so
Okay, and I'll second that.
That's not it.
no, 1476.
All right, do you wish to speak to your motion?
Sure, this was brought forward because I feel, and I think listening to the majority of the folks here on the ED&A committee, feel that it's appropriate that OPLC have a dedicated lapsing fund, non-lapsing fund of up to $3 million. But once it gets to that 3 million, the bill as it came over sent any surplus over 3 million back to the general fund. I think it's important that that money be used to reduce licensing fees and certification instead of just filling the coffers of the general fund. This is what that is intended for, and this is what this amendment does, is keeps that money towards fee reductions.
Are you making that motion, Representative Goldie?
I am.
Second.
Thank you, Representative Schmidt.
Okay. Do you wish to speak to your second?
That's
Okay. Anyone else have a comment, a question? Representative True and then Simon.
I offer my sincere congratulations to the representative in the corner. My objections, I thought we were overtaxing for money just to go into the general fund. And that would have been a no for me. Limiting it to 3 million, I know they had a problem with money running out, all the money going back to the general fund and them not having any money to run. Limiting it to 3 million seems fair to me.
Representative Simon?
Thank you, Madam Chair. Yeah, I'm in support of this. I just wanted to make a mention of, I'm assuming that the OPLC will be in charge of redistributing licensing fees and certification fees under this. My only concern, and just for the record and for the record only, is just redistribution of one board's fees to other boards. I like it way better than sending it to the general fund, but I'd love to know how OPLC is going to do that in a correct manner. Jeff, do you have
Yes.
any idea?
We are all interested.
And I think if you look down to line 15, that the Office of Professional Licensure and Certification shall report biannually each July on how the funds were expended over the previous biennium. So hopefully in that reporting, we will find out where the money is going.
They are also required by other statute that they report annually to that same list of people on all of their boards, what they've done, and it includes things like how many people are licensed under each board, how many complaints, and what the fees are. And it's very easy to look at that and say, this board is paying too much, and this board is probably isn't paying enough. So I think that's, we should be able to adjust how they're expending it. Representative Simon?
Yeah. My only other thought too is maybe we can communicate with OPLC, although I know they know this is a concern as well, keeping those fees consistent from year to year so that the licensees know when there's a drop because of excess funds and to expect it to go back up the next year, so that they have an anticipation of what's coming down the pike.
Yes. I'm sure that it's going to be interesting to see how they adjust the fees. All right. Any further comments? Those in, the motion is to adopt Amendment 1476, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
Yes.
Representative Santo-Anastazo,
Yes.
Representative True,
Yes.
Representative Dolan,
Yes.
Representative Abar,
Yes.
Representative Gerhardt,
Yes.
the clerk votes yes. Representative Schmidt,
Yes.
Representative Goley,
Yes.
Representative Schuett,
Yes.
Representative Horrigan,
Yes.
Representative Grassi,
Yes.
Representative Davis,
Yes.
Representative Fitzpatrick,
Yes.
Representative Gould,
Yes.
Representative Smith,
Yes.
and the chair.
Yes.
19 to 0, the amendment is adopted.
Okay, Representative Goley?
Madam Chair, I move ought to pass with amendment.
Second.
Okay. Wish to discuss it, add anything to the previous discussion? Okay, Representative Schmidt?
I'm good, thanks.
Okay, anyone else have a question, comment, concern? Okay. By all, replace all amendments, make it easy. So the motion is to, ought to pass on Senate Bill 49 with Amendment 1476, and the clerk can call the roll.
Representative Simon,
Yes.
Representative Lucas,
Yes.
Representative Bailey,
Yes.
Representative Santo-Anastazo,
Yes.
Representative True,
Yes.
Representative Dolan,
Yes.
Representative Abar,
Yes.
Representative Gerhardt.
Yes.
The clerk votes yes. Representative Schmidt,
Aye.
Representative Goley,
Yes.
Representative Schuett,
We.
Representative Horrigan,
Yes.
Representative Grassi,
Yes.
Representative Davis,
Yes.
Representative Fitzpatrick,
Yes.
Representative Gould,
Uh-huh.
Representative Smith,
Yes.
and the chair.
Yes.
19 to 0 ought to pass, but amendment is adopted.
All right. Motion passes 19 to 0. Any objection to consent? Okay.
And for the record, I am reliably informed by knowledgeable sources that uh-huh is actually comes from the Abenaki word for yes.
Yes, thank you, Representative Schmidt.
Yes, thank you. My
For that
dyslexia, I would get
footnote.
it backwards.
All right. Senate Bill 71. Representative Simon, you've got an amendment.
Yes, Madam Chair. I move Amendment 1521H.
Is there a second? Okay, second.
71.
All right, you just speak to your motion.
Sure. So the bill, as it came to us, had two parts to it. The first expanded the presumption that cancer disease in a firefighter was occupationally, had occurred occupationally. And so for the purposes of workers' compensation, it would be presumed that that cancer was caused while on the job. And the second part formed a commission to study a screening for firefighters. This amendment keeps the first part of the bill intact and strikes the commission. The members of the subcommittee were agreed that the commission was likely to be ineffective in reaching the goals that it wanted to achieve. And so we took that out.
Representative, who did second that? True. Representative True, do you wish to speak to your second?
Yes, just to clarify a little bit what we did in the subcommittee. This makes it a presumption that that cancer within a firefighter is workman's comp, would be a workman's comp case. That presumption, as it was explained, does not mean a guaranteed coverage. They gave an example of a case that was under cover, that was being covered as the law is now, and it went before workman's compensation. They argued the point, and the case was denied, even though that particular cancer was one that came under the presumption.
Okay.
So knowing that, the presumption is not an automatic guarantee of workman's compensation. It still has to be proven beyond a reasonable sense of doubt. I came to the conclusion that this amendment should pass.
Okay. Representative Lekis and then Schuett.
Just glad to see that the amendment fixes the problem of a committee which is formed, its report is due, and it's ended all in the same day.
Yes, that was a special case. Okay, Representative Shuhon.
Do you have a question?
Yes, I thought we had talked about eliminating the Cancer Society from the membership.
Well, that's, if we're deleting the commission, it doesn't matter.
Okay, this is deleting, okay, all right.
Right, if I may, the point is that this information is needed, but in a short period of time, that study commission was just infeasible.
Right.
So we hope that the insurance company or workers' comp or the employers of firemen will do some studies.
Okay.
We just don't think that one is going to work. Okay. Any other comments or questions? Sure, Representative True.
But fun. Another problem with the bill as it was written is that in any committee or commission, the legislature must form a majority of the committee. And in the bill as it was written, we were the minority. And that is, just for future reference, we'll probably never hear of a committee or a commission again in this committee, but the legislature must form the majority of a committee.
Okay. And on a technical study like that, I don't think there'd be very many legislators who would usefully contribute to the study. All right. Anyone else have a comment, question? Okay, the motion is to adopt Amendment 1521 to Senate Bill 71. The clerk can call the roll.
Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
Yes.
Representative Santonastaso.
Yes.
Representative True.
Yes?
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhardt.
Yes.
The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
The count is 19-0 to adopt the amendment.
All right, so Representative Simon?
Yes, having adopted the amendment, I move SB 71 to pass as amended.
Is there a second? Second, Representative Goley. Any further discussion or comment? All right, seeing none, the clerk can call the roll.
Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
Yes.
Representative Santonastaso.
Yes.
Representative True.
Yes?
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhardt. The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
19-0, OTPA is adopted.
All right.
Consent calendar.
Any objections to consent? The motion passed. Okay, we'll put that one on consent. And that's, all right, Senate Bill 44. Representative Grody, you have a motion.
I do. Let me just see if I can find it. Yes. I would like to move Amendment 1453.
Is there a second? Second by Representative True. Okay.
Okay.
Yes, this one is.
Okay. So this amendment was brought to the subcommittee this morning. And the amendment is very similar to the bill, except for on the back. well, it's not on the back of this bill, but it removes the criminal justice degree from the requirements, and because originally it had been put into this bill, it is not in current statute. It had been put in because one of the local colleges was going to offer a course that was going to be acceptable by the board, but they have withdrawn the course. And if it involved criminal justice, so any kind of we did clear with the director of OPLC that should there be a college course or college program that allows criminal justice to have these kinds of courses that are required for this kind of practice, it can be added during rulemaking. So what this amendment does essentially does the same thing as the original bill, was to allow individuals who are being treated and followed by members of the LADAC board continue to be treated by those specialists, even though their substance abuse might be Controlled, yes. Let's use that word. Because typically, if someone who sees the LADAC specialist has their substance abuse under control, their substance use under control, they are then required to go seek counseling from another type of specialist. So therefore, this allows continuity of care for those individuals.
Anyone else? Representative Blackus.
Yeah, people might notice there's some change in the wording for the education requirements, but it has no real change. It just changes the language that's used. The requirements are basically the same.
Okay. I'd like to mention that what it also does is that it increases the number of mental health professionals of the state simply by allowing them master's levels LADEX to treat non-co-occurring disorders. So I think that's important.
Madam Chair?
Yes. Sir.
I'll just note also that we heard during testimony that in many cases it was very important for the client to continue a relationship that they had developed with a counselor. So I think that's an important facet.
Okay. Anyone else? Okay, so the motion is to adopt Amendment 1453 to Senate Bill 44, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
Yes.
Representative Santonastasso.
Yes.
Representative True.
Yes.
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhard.
Yes.
The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
The amendment is adopted 19-0.
Okay. Representative Lekis, do you have a motion?
Yes, OTPA on Senate Bill 44 with the amendment.
I'll second.
Second. Okay. Do you wish to speak to your motion?
I think we covered most of it. It increases the scope of practice for the MLDAX. It allows, as was mentioned, continuity of care. I mean, it's hard enough for somebody to find a mental health counselor that they work well with, to have them, once they've dealt with one problem, now they have to go find somebody else is, I think, not reasonable. That's basically what it does.
All right. And any other comments? Seeing none, the motion is ought to pass as amended by You're correct, Representative Schmidt, I forgot. With amendment on Senate Bill 44.
Okay. Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
Yes.
Representative Santonastaso.
Yes.
Representative True.
Yes.
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhard.
Yes.
The clerk votes yes. Representative Smith.
Yes.
Schmidt. Yes.
Both of us.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Okie dokie. Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
Then the chair.
Yes.
The OTPA is adopted 19-0.
Is there any objection to consent? Seeing none, we'll put this one on consent also. And moving right along, Senate Bill 149, Representative Broda.
Madam Chair, I'd like to move Amendment 1463H.
Okay. Is there a second?
I'll second it.
Second by Representative Lekis.
In this, there were two changes made to the bill. Number one, it references a different RSA. The original RSA that was referenced in the bill, in the original bill, was referring to the nursing board, and this is actually a nursing agency registration. It is nothing to do, it is not related to the nursing board, and therefore we're giving it its own individual chapter in RSA, which is 326M, as recommended by OPLC. The other change is in the back. Yes. In on page 2, line 6, into line 8, the sentence ended with "for such reason," which didn't really have anything, there were no reasons given in that section, so that was eliminated. So the sentence reads, nurse agency shall not commit the services of a single nurse or licensed nursing assistant to more than one healthcare facility for the same time period or a shift, and cancel a commitment to a facility or compel that facility to bid again for services already promised it, period. Those are the changes that were made to the bill.
Okay. Representative Lekis.
Thank you. All I'll say is, even if people have a problem with the underlying bill, I suggest supporting the amendment, because if it were to pass, without this, it would get stuck under the nursing board statute, and that would make no sense, as well as the grammar fix.
Okay. Representative Simon.
Thank you. Was there any talk in the subcommittee, I'm just curious, about whether or not this section 6 through 8 on page 2 will delay nursing agencies from committing to one facility?
No.
Is that on the amendment?
Yeah, on the amendment.
It's also in the original bill, right?
Oh.
I was just curious if they're not allowed to basically make somebody bid for a contract that they already have, because they're doing that last moment presently, if they'll delay committing to one group until right up until the last minute.
We didn't hear anything specific on that. All I'll say is that apparently other states have much more onerous bills that even have things like price controls, which I would never support. But they are apparently able to staff. So I would not expect that this would cause that much of a problem.
Other questions or comments on the amendment? Representative Gerhard.
Thank you. On page 2, line 12, just when it says they would not be able to charge a higher rate unless there's a state or local declaration of a public health emergency, who at the local level, what does that mean exactly?
Oh, local level, if you're, I don't know if the localities have an opportunity to declare a state of emergency. They do?
They can.
Oh, okay.
I think the
For
ones,
example, they said there's measles running around Hampton, and so that, which is a communicable virus, and that would apply.
Follow up. I just wonder if that's an end run around the idea of keeping rates down. So, for instance, let's say a town wants to declare a public health emergency that they can't find people to man the nursing home. No? Okay.
so if I can comment?
Please.
I mean, there's nothing in this bill that prevents them from charging anything they want, separate from the issue of a bump for an infectious disease. So if they want to, if the best one out there is offering an extremely high rate, then that can happen, and they don't have to use the infectious disease as an excuse.
No. It just eliminates that one reason for a spike in prices. You have to negotiate your exorbitant rate in advance.
And if your concern is that the public health emergency would be used to allow it, I don't see how the local Board of Health or whatever it is would have an incentive to do that, right? I mean, it wouldn't be in their benefit to do it, and so I really don't expect that to happen.
You'd have to have a nursing home in that community for
Right,
that,
and why
for that to work.
And I don't see how it could be in the interest of the
Of the
local
town.
public health people. It'd be the opposite. I mean, I can't see them doing it for that reason. So.
Okay, Representative Dolan?
FYI, most towns do have a public health officer, which is often in smaller towns, it's often double duty of the fire chief. And that's who can declare that.
No. Or they might, or one of the selectmen gets tagged with it. All right, anyone else have a comment, concern? Representative Gould?
I just will add that you would have to have the local officials in cahoots with the nurse. Like, it would have to be a major conspiracy.
Yeah. Well, they could, but as Representative Leckes pointed out, it's not to the benefit of the local official to let the agency charge more to their local nursing home or whatever. All right. Any other comments? Okay. The motion is to adopt Amendment 1463, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Leckes.
Yes.
Representative Bailey.
Yes.
Representative Santonastaso.
Yes.
Representative True.
Yes.
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gerhard.
Yes.
The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
Yes.
The amendment is adopted 19-0.
Okay. Representative Broder?
I move auto pass on House Bill. Auto pass with amendment on House Bill 149. Senate Bill 149, excuse me.
Second by Representative Gould. Do you wish to speak to your motion?
Right. So this bill came to us because of concerns by the healthcare agencies that their staff was being sent to the highest bidder, which makes it very difficult for people to control their health care. And therefore, this bill does really a few things. Number one, it allows for a nurse agency registration in the state. So therefore, these companies that are providing nurse agencies to the state are on record. The other is that it does not allow them to, if they've committed to a nursing facility, they can't remove that nurse to another facility because the other facility has outbid the current facility. And also, importantly, the nursing agencies cannot place licensed individuals with a license that has been suspended. So these are all things that I think help local nursing facilities, and which should help at least keep track of the rising costs of care in our state.
Representative Lekis?
Yeah, I mean, I'll make an argument for it that's slightly different. I don't have a problem with things going to the highest bidder. The way to solve that is get more supply. However, what they're apparently doing is coming to an agreement on a price for a nurse, and then at the last minute saying, oh, well, we have a better offer somewhere else. And that's, at best sleazy and unethical business practices, and it may actually be a violation of their contract. And we asked, during the subcommittee about, remedies for that. If it is a violation of the contract, it would go to the Attorney General. And what we heard is that really nothing happens. It's not effective. And it's largely for that reason I was willing to support this. And I mean, the part about, if they're placing nurses with suspended license, I mean, that's illegal already. It's just the nursing agency can be on the hook for doing it. And I asked about enforcement, because if we do things that there's no way to enforce it, it's pointless. And we were told that, that OPLC can talk to them about it, go after them, but ultimately they could either be fined or prohibited from contracting in the state. And so that would act as a pretty strong disincentive for this kind of thing. And the deal about prohibiting the upcharge for infectious diseases, I'd kind of prefer that wasn't in there. And in general, I prefer that this was handled through contract and consumer protection stuff, but apparently that isn't working. I don't think the upcharge thing is that significant because, they were doing it again at the last minute, which is not the way to do business. There's also a prohibition against recruiting on the grounds of the facility. And I think that's, almost meaningless. They can get a hold of somebody in other circumstances. So I don't care too much about that. But it's basically, I think, bad business practices and possibly contract violation is why I was willing to support it.
Okay.
Well, the thing is, the reality is
Schmidt?
that none of this may be effective in preventing this situation. It does give some kind of possibility of slowing it, inhibiting it, or sanctioning it after the fact, but it's better than doing nothing.
Okay, Representative Lekis, you.
Yeah, just briefly. This is not going to fix the underlying problem of, facilities having to pay a huge amount of money to get nurses to cover when people leave or away for some reason. The only solution to that long term is to increase the supply, and whatever we can do to help that we haven't done, we should. But it'll hopefully stop some pretty egregious business practices.
Yes. Representative Gerhardt?
Yes, just following up on Representative Lekis's comments on the recruitment of potential employees on the premise of a healthcare facility. It just seems very vague, and I think it could be used as a justification for firing employees that, whatever the reason, it just seems like it's an unprovable thing either way. There's no enforcement mechanism, but it can still be used as justification for harassing someone or whatever. If you really want to stop that, then we should have them all wear body cameras or something. It gets into this very weird Big Brother-esque kind of thing. That's my opinion. Thank you.
Yes, I think that the main thing it will do is prevent the agency from posting on the employees' bulletin board, want more. You can't stop people talking to each other, and I'm sure the nurses will talk to the agents, people.
The word will get, if I could, the word will get around. The other thing is, the facility's problem is they can't recruit and retain enough nurses. I don't see that they would be using the fact that somebody who works there talked to one of the contracted nurses about a job as a reason to fire them, because their problem is they don't want them to leave. So I just don't see it as a real problem. That's all.
Okay. Representative True?
Thank you, Madam Chair. I like to believe that I always have a problem when we pass a law that's unenforceable. And so, like in the situation where you're not allowed to talk to other employees, I don't see how that's enforceable at all. Nor do I see a nursing home wanting to enforce that. As far as the nurse agency shall not commit to services of a single nurse, et cetera, et cetera. That's on second page 2 of the amendments, line 6. What I heard in testimony is, I believe it was the director of a nursing home, maybe Hillsborough, I'm not sure, that he would get between a rock and a hard place and he'd have somebody lined up to work, and they needed that body there to make the ratios of employees to patients. And at the last minute, that nursing agency XYZ pulls the rug out from under him. And he has to pay extra money to go to nursing home, nursing agency X. But he has no way of punishing the agency that did that to him, because he needs them maybe next week. On the amendment, on page 1, line 29, the director may revoke, right? I don't know if that's going to happen. I don't know if that's going to be another unenforced rule because of the shortage. And that's the whole problem of all this, is we have a shortage. I don't think that's going to be a molehill that I'm going to die on, but it just seems unenforceable. Thank you.
Anyone else? I'd have to say I kind of agree, except that I would imagine that the director of OPLC would have more clout with the Attorney General saying, well, here, I've got 17 verified complaints against this one agency, than, you know, each nursing home calling in once and saying, you know, they screwed me. That's the only way I think it's likely to get more enforced, is if we can consolidate the complaints and then sick the AG on them, because that would make it more likely that something might happen. But anyone else? All right. In that case, the motion ought to pass with amendment on Senate Bill 149, and the clerk can call the roll.
Representative Simon.
Yes.
Representative Lekis.
Yes.
Representative Bailey.
No.
Representative Santonastasso.
No.
Representative True.
Yes.
Representative Dolan.
Yes.
Representative Abar.
Yes.
Representative Gearhart.
No.
The clerk votes yes. Representative Schmidt.
Yes.
Representative Goley.
Yes.
Representative Schuett.
Yes.
Representative Horrigan.
Yes.
Representative Grassi.
Yes.
Representative Davis.
Yes.
Representative Fitzpatrick.
Yes.
Representative Gould.
Yes.
Representative Smith.
Yes.
And the chair.
No.
Okay, it is 15-4. The amendment, the OTPA passes, and will there be a minority report? Or, sorry.
That's okay. You're practicing. I'm not going to write one.
It can't go on the consent, right?
It's not going on consent.
No, no.
I
not
object
with-
to putting it on
Not
consent.
with 4.
I could put a minority report together. ChatGPT.
All right.
Yeah, I'll just throw some stuff in the chat.
Okay, so Representative Santonastasso wants to write a minority report. All right, that. Okay, we have not yet doubled up anybody. So, the last bill, Senate
Motion
Bill.
will be ITL for you.
Okay. And Senate Bill 207. I had an amendment which was, I didn't pick one up myself, but I put it out there, which deleted, I moved that amendment, whatever number it is. Is there a second?
Well, I don't know what the amendment says. We don't, let me go get the amendment.
Okay, I put a stack of them out there.
Getting signals that your microphone is still on.
Okay. Oh, okay, sorry about that. Yeah, Senate Bill 2 is. Oh, good. That's what, that's, okay. Okay, so Representative Simon has seconded my motion. And what this amendment does is simply delete the study committee on licensure of mental health professionals. Since we're doing that all over the place in subcommittees and retained bills, so I don't want to create a formal committee. But we didn't get much testimony about the medical and trauma services, so I thought we should at least discuss it and see if it's important. And I have nothing else to say. Representative Simon,
I have nothing to add. Thank you.
does anyone know anything about the peer support groups? Or remember any testimony about it? Okay, Representative Gould, please.
Sorry, I know a little bit about them. It's sort of anecdotal information. I know a family member is a client, and then a friend is a staff. So, all I can tell you is that it's an important and emerging, I think, aspect to mental health services by allowing people who are doing well in their life, but who have had experience and understanding to be able to be employed to assist. And I can give you an example. The peer support people were being called upon when we had I think it was about 4 weeks ago, there was a crazy amount of actively psychotic people being warehoused in the Concord Hospital. And so they had people in active psychosis strapped on gurneys sitting around in the halls. And so this peer support group was able to be called upon to come in to help assist with keeping the clients calm until something better could be figured out.
Okay.
But anyway, so those are the kind of services that they provide.
All right, thank you for Representative Blackus.
Yeah, my understanding, I mean, I think I was out sick the day this had the hearing, although I guess there wasn't much presented. But in looking it over, I'm not sure it would apply in that case. It seems to be support of other employees as opposed to patients in the hospital setting like that. My question is, assuming that's correct, I mean, there's no money for this. So is there anything right now that would prohibit, let's say, a fire department or a police department or anything like that, or their unions from organizing this right now? I mean, is there really a need for this, and how does this do more than what they can do right now?
Yeah, I thank you. I tend to agree with you. I don't know what it does. Representative Gould.
Thank you. I'm sorry. I'm trying to write my report for you before the end of the day and wasn't paying super close attention. So this kind of support group is for, we heard testimony, remember, about all the trauma that the police and other first responders are serving. So that's what this is in reference to. But it's the same kind of concept as what I was talking about. It's
Well, okay. Do you have information on this? If you please. The testimony at the hearing was, I can't remember any of it.
Good afternoon. For the record, my name is John McAllister. I'm Secretary Treasurer for the Professional Firefighters of New Hampshire. And I hope I can maybe help answer some of the questions that the committee may have.
Okay. I remember Representative Prue was on something like this where they dealt with first responders who had been in traumatic situations.
Correct. In the organization that Representative Prue belongs to is a critical incident stress debriefing team. So after a critical incident that a fire department or police department may deal with, they call this team in, and they have the team counsel the members that were involved with that directly. As far as peer support groups, which the Professional Firefighters of New Hampshire, we have our own peer support team. The International Association of Firefighters, which is the organization that we belong to, they have established a peer support program. And the peer support, the idea of the peer support teams is a one-on-one peer-to-peer counseling. So they will send our members to a class. It's a couple day long class where we will learn how to deal with peer support one-on-one. And it's basically firefight. In our situation, it's firefighters helping other firefighters.
Okay. An excellent program, but I don't know why you need statutory authority to do that, because if I understand it, the current law talks about the critical incident stress management team is one or more trained volunteers, including members of peer support groups. So it sounds to me like you can do this already.
Well, excuse me.
Lieutenant
So under the current RSA, the individual peer support teams are not covered, and and I believe that's what
for what?
for the.
You mean they're not codified? Is that what you mean?
I'm sorry. What was that, Representative?
I'm over here.
I'm sorry.
They're not codified or defined.
Correct.
If I could help.
Yes, please.
So when there is a peer review can be done many ways. And one of the ways that is done professionally in the mental health area is when you have social workers who work for the same practice and they see different cases, but sometimes they need confirmation from their fellow social workers that indeed they're following the right course of practice. I mean, doctors do this too. I mean, they have case reviews where they all sit around the table and they talk about someone's medical condition just to make sure that the condition that the protocol that's been outlined for that individual is the correct one, is the most likely to succeed. So when this is done on this kind of a basis, it's done with individuals, for example, like firefighters. It could be with individuals who are handling an issue with the town. I guess Representative McGuire's amendment addresses this, and this was in the original bill.
Yes.
What her amendment does is eliminates the commission. And just keeps the original part of the bill. So I don't know why did you do that as opposed to why did you kept this because
we didn't get any testimony on it,
that's right.
and I thought it might be important, and I figured we should at least talk about it.
Okay.
I'm not willing to say I'm strongly in support of it, but I'm much more in support of this than the study committee.
Okay, I'm gonna Can I,
Oh, sorry.
can I
So,
comment
yes,
on that?
Please continue.
Okay, so I was on the study committee, and I am in support of the study committee because, and I think that this was brought out as a result of some of the testimony that we had in the study committee. And frankly, I was more focused on the study committee than I was on this part. So this sort of caught me by surprise. But so I, let me see. I'm just going to read this quickly.
Okay, yeah, I will say that I took out the study committee because we have at least one retained bill and pieces of House Bill 2 and House Bill 655 that we are looking at, and specifically on the licensure of mental health professionals. And I don't think we want to create a separate study committee when we're already looking at that. So that's why I took the study committee out. Wasn't sure that this was useless, so I left it. So Representative Goldie, you're more familiar with it?
Thank you, Madam Chair. And I think if I recall correctly, that the definition of peer support group was put in place because we all know Representative Prue does this type of work. And I think this establishes what a peer support group is and puts it into the statute, and also includes peer support group for providing these services to not only our first responders, but anyone who may need their services. It just increases the number of folks who are going to be allowed to provide those peer support for those in need, whether it's for stress management, critical incident stress debriefing, or any of that. I think this defines what his group does and what his organization does and helps going forward.
Representative Blackus.
Yeah, I have a question on that, and I mean, I think the idea in doing this is great, but you said this would allow more people to get involved, if I heard you correctly. I mean, what's preventing them without this from doing it? I would think that any fire department, any police department, and maybe other organizations or the unions in conjunction with them could do this kind of thing. And I'm just reluctant to put things in statute that aren't really necessary, or that might kind of fossilizes things in a certain state and might reduce some flexibility. So I'm really wondering.
I think I have an explanation.
Okay.
Okay.
So according to RSA 281-A:2, it defines emergency 281-A:2.
913 on page.
Yes, right. That means it's been defined as call, volunteer, or regular firefighters, law enforcement officers, certified county correction officers, emergency communication dispatchers, and rescue or ambulance workers, including ambulance service, emergency medical personnel, and first responder service and volunteer personnel. So that without meeting those requirements, any other organization cannot participate or cannot be considered this under that RSA. Is that correct? That's the way is that correct?
Yes, that is correct. And it's for liability reasons.
That's
Okay.
liability. I forgot that part.
Right. So it says the critical, and then in RSA 153A:17, it reads, critical incident stress management team or team means the group of one or more trained volunteers, including members of peer support groups organized by a unit of state, local, or county government. And then this is where, or members of the Union of Emergency Response / Public Safety Workers as defined by RSA 281:2, paragraph 6.
Okay. So what this does is it
It expands.
expands it. Okay.
Yes, thank you. So that's why we needed that. But and I guess we're voting on this, but I would like to, I will be voting no because I want the whole bill. I want the study commission because being on the study commission, which we met 4 times just to address the issues that had to do with licensing and certification of those individuals who are working with mental health care, and there were still, and many of the issues are going to be addressed in House Bill, not the House Bill, in the non-germane amendment to House Bill 518, as we refer to that House Bill never to be named. And then we will continue, we want to continue that work because we felt that we had more information. Did you want to say something?
Thank you. Thank you, representatives. My name is Marissa Chase. I'm the executive director for the New Hampshire Association for Justice, Euphemism for the Trial Lawyers. Senator Birdsell, working with one of our members who exclusively does workers' comp on behalf of plaintiffs and often works with PFF&H. Senator Birdsell had asked for help around this language, so I apologize. Senator Birdsell had reached out to this attorney for help with this language, and I have a note on why it's important, if that would be helpful for the committee.
Please.
So if I can get my phone to cooperate here. Okay. So critical incident stress management team, or team, means the group of 1 or more trained volunteers, including members, peer support groups, or members of a union of emergency response public safety workers as defined by RSA 281A:2 VI, which I believe was reflected in Senate Bill 207 as amended, not in the original bill. There was some debate around the language to be able to encompass peer support groups across the spectrum, not just, because they're defined differently in different areas of statute. The above is, I think, a narrow definition, definitionally limited to the classes of first responders already defined by the workers' compensation law, and then only to establish unions of such first responders. This narrowly defined expansion eliminates any union of non-first responders from coverage by definition, and further addresses concern about a future expansion by avoiding entirely a regulatory loophole of and administrative burdens caused by any other employee organization applying to the safety commissioner for workers' comp coverage. When we talk about liability, we're talking about coverage under the workers' compensation statute, making sure these folks are eligible for workers' compensation. With the language is drafted, meaning without any savings clause like, quote, or other such organization approved within the discretion of the safety commissioner, unquote, no union beyond those already blessed as first responders by RSA 281A can even get in the door. That's why this is so important. As a reminder, the definition of emergency response public safety workers in RSA 281-A:2 6 means call, volunteer, or regular firefighters, law enforcement officers certified under RSA 106-L, certified county corrections officers, emergency communication dispatchers, and rescue or ambulance workers, including ambulance service, emergency medical personnel, first responder service, and volunteer personnel. So I hope I clarified that and didn't make it more confusing, but the real underlying need for this is to make sure that these emergency peer response groups are eligible for workers' compensation coverage when performing their, a really valuable service.
Okay. Yes, Representative Bailey.
Are we expecting something to happen to them while they're counseling?
Looks like it's a very difficult question.
No, it's not a difficult question. I guess it's so much as to be covered under liability as well, not just so much workers' compensation.
So previously it was
Follow up.
previously it was defining these are the people that can be in this group counseling or something, right? So I assume whatever has happened. This is after the fact. So why is there some danger in doing this? Or
So I think it came up in testimony, and Representative Grota would know better than I, but I believe what happened is some of these peer support services are given by retired members that are not actively part of a union. So this is making sure that they are covered when they're engaging in peer support services.
Covered for what?
Cover for workers' compensation liability, making sure that if something does happen, then they are covered as well.
I
And
see, the
it's an
count- the-
incentive mechanism to be able to get them to engage in
Something
the
goes
peer
wrong in the
support.
counseling, and then they're to be sued, and are we covered? Okay, I understand. Thank you.
Okay, Representative Gould, have we covered your point?
I think so, and I'm assuming, like, I know there's a lot of reticence among the field. I'm okay. I'm a big, strong guy. I don't need help, or woman. And so, does any of this language and making it defined and easier for peer support people help by codifying it? Are we helping encourage departments to set up peer support groups, or just protecting them?
I believe they go hand in hand.
It also protects these members on the confidentiality clause.
Okay. Representative
Could,
Lekis.
could you expand on that? The confidential clause, what's that about? How does it work?
Yeah, thank you, Representative, for your question. Basically, it'll cover these individuals if they are talking to another peer in one of these situations, and the peer explains something to them that they're going to be taken into confidentiality and not required to report to the law.
Follow up?
Follow up.
So where in statute or somewhere else does it actually talk about that and indicate that they would then be covered by that if this bill became law?
I don't know that answer.
Look at the definition.
Okay. I think okay. Yes, I think we should cut this off. Yeah, this is definitely more complicated than I thought it was when I originally came up with this amendment. So I'd like to send at least this part of Senate Bill 207 to Representative Simon's subcommittee.
And Madam Chair, if I may, whenever that subcommittee is scheduled, I'd be happy to make a workers' comp attorney who can better answer any of your questions than John or I are trying to hopefully lend some clarity.
Yeah, I mean, I'm still confused of whether we need it and what kind of liability issues we're dealing with, but we'll let the subcommittee dig into it.
That's okay, Madam Chair. I think my subcommittee is becoming slowly experts at workers' comp all of a sudden. So
Congratulations. It's always good to learn things. All right. No. Okay, that completes our actions for today. We have 2 bills that we haven't finished that we will pick up later on, and the subcommittees will be busy. And the subcommittees will be busy. They will be scheduling the meetings. And I have a report from Representative Schuett and from Representative Goldie. Thank you very much. Representative Gould, Simon, Grota, and Lekis, 01 each. So, and I
you just need it tonight.
as soon as possible, yes.
108.
Yes,
this
thank
one
you, ma'am.
Right there.
I'll check you off. You have it in?
I do, and feel free if it's too wordy or
Okay.
whatever.
Goldie's got his in.
By the end of the night, is that sufficient?
As soon as you can. No, there's work and stuff.
What's that?
There's work and stuff.
It's been a tough week for me, but I will get it to you by the end of the night.
Okay. All righty. Yes, they came this way.
Representative Grote.
I think I got them.
Jackie, have you set your subcommittee
Yes,
up?
it's a little wordy, but it's